yenye ugumu wa maisha, yani hardship area. Anadai kwamba Mwea ni sehemu ya tabu chungu nzima, kwa hivyo inastahili kuorodheshwa kama sehemu yenye ugumu wa maisha. Seneta Murango anaomba kujua ni lini ambapo wizara husika ya serikali itajumuisha eneo bunge la Mwea kama sehemu yenye ugumu wa maisha, ili wafanyikazi wa serikali waanze kufidiwa kwa sababu ya ugumu wa maisha. Wanapitia ugumu ndio wakati ambapo wako kazini, wanajitolea kufanya kazi zao, lakini hawapati fidia kwa sababu ya huo ugumu. Tunazungumzia madaktari, tunazungumzia wauguzi, tunazungumzia walimu. Hawa hawapati kufidiwa kwa sababu ya ugumu wa maisha katika eneo la Mwea. Naam. Nikija katika ratiba ya shughuli za bunge la seneti asubuhi ya leo, shughuli nambari 8 ni kuhusu hoja ambayo inahusu kutangazwa kwa wizi wa mifugo kama janga la kitaifa na pia kuanzishwa kwa hazina ya waathiriwa wa wizi wa mifugo. Mhusika mkuu katika hoja hii si mwingine ila seneta wa Baringo, Seneta William Cheptumo. Seneta Cheptumo anasema anafahamu kwamba wizi wa mifugo ni tatizo kubwa mno katika maeneo ya kaskazini na kusini mwa bonde la Ufa na pia sehemu zingine nchini. Na anasema ni tatizo ambalo limeacha madhara makubwa katika sehemu hizi. Anasema kwamba kutokana na wizi wa mifugo, wanawake wamesalia wajane, watoto wamesalia mayatima, na pia kuna wanaume wengi sana ambao wamesalia bila wake zao kwa sababu wameangamia katika wizi wa mifugo. Na wizi wa mifugo hupelekea kusimamishwa kwa huduma zote. Ni kwa sababu kukiwa na wizi wa mifugo, hali inakuwa ya taharuki sana, wala hakuna usalama. Kama ni masomo yanasitishwa, kama ni ukulima unasitishwa. Kwa sababu hebu niambie, walimu na wanafunzi watafika shule namna gani pasipo usalama? Wakulima nao wataenda shambani namna gani pasipo usalama? Isitoshe, tunao madaktari na wauguzi ambao wanatoa huduma za afya hospitalini. Watafika namna gani hospitalini kutoa huduma hizo pasipo usalama? Eti watu ambao wanaishi katika sehemu hizi wanaishia kukosa na kunyimwa haki zao za kijamii, haki za kiuchumi na haki za kisiasa kwa sababu tu ya wizi wa mifugo. Kumbuka hizi haki ni haki za kila Mkenya na hii ni kulingana na katiba yetu. Kwa hivyo, Seneta Cheptumo wa Baringo County anaomba bunge la seneti kupitia wizara ya masuala ya ndani mwa nchi na mipango ya kitaifa itangaze wizi wa mifugo kama janga la kitaifa. Anaomba wizara hiyo ya Waziri Profesa Kindiki ibuni kamati maalum. Kazi ya kamati hiyo itakuwa kuchunguza kiini cha wizi wa mifugo na pia kubaini madhara ambayo yanaletwa na visa vya wizi wa mifugo katika jamii zilizoathirika. Hatimaye, seneta wa Baringo anaitaka wizara ya Profesa Kindiki izindue hazina ya kuwafaidi waathiriwa ama ya kuwafidia waathiriwa wa wizi wa mifugo na kuwapa makao mapya. Manake wizi wa mifugo ukishamalizika, kuna watu ambao wanaachwa bila makao. Kwa hivyo hazina hii itashughulikia kuwapa hawa Wakenya makao mapya. Nikizidi kusonga mbele, manake ni wazi kwamba hakidi haijatimizwa. Shughuli nambari 9 katika ratiba ni hoja. Hoja yenyewe inahusu kutwaliwa kwa mali ya watu wanaokosa kulipa mikopo kutoka kwa taasisi mbalimbali za kukopesha pesa. Mhusika mkuu katika hoja hii si mwingine ila Seneta Wahome wa Matinga. Mtazamaji, utakubaliana nami kwamba nyakati ni ngumu sana, sio kwako, sio kwangu, bali kwa Wakenya wote kwa jumla. Kwa hivyo, unaposhindwa na kukwama kabisa, unakimbilia mkopo kutoka kwa benki au vitaasisi hapa na pale kwa minajili ya kujikwamua. Sasa, hebu nieleze, hali inakuwaje unaposhindwa kulipa mkopo huo? Taasisi hiyo inatuma watu kutoa bidhaa zako ama vitu vya nyumba ili wauze ndiposa warejeshe pesa zao. Seneta wa Matinga anasema kwamba vijana ndio watu ambao wanaathirika zaidi kwa sababu wanachukua mikopo ya kufanya biashara aghalabu waweze kujikimu kimaisha. Mikopo yenyewe wanatumia kununua vigari vidogo vidogo na pikipiki. Halafu wanaanza biashara ya Uber, Taxify, Bolt. Sifahamu iwapo tumefikisha akidi. Naona ni kana kwamba tumefikisha akidi. Kwa hivyo kikao kianze rasmi. Shukran kwa sasa.
Order number 4, petitions. Order number 5, papers. Order number 6, notices of motion. Order number 7, questions and statements.
Now, honorable senators, we had invited 3 CSs, that's including the Prime Cabinet Secretary, for purposes of responding to questions this morning. However, the Prime Cabinet Secretary will not be able to attend this session today for purposes of responding to question number 018, as he is engaged with a visit of His Majesty King Charles III as the escort of honor, and therefore he will not be able to be in the Senate for purposes of responding to that question. However, we do have the CS for Health and the CS for Public Service, who are within the places of Parliament for purposes of responding to the questions posed to their ministry. We will therefore proceed to question number 019, and clerk kindly usher in the Cabinet Secretary in charge of health. Now, I've just been informed that the Cabinet Secretary in charge of health is already in the chamber. Let me take this opportunity to welcome the CS Health. Welcome to Parliament, and particularly to the Senate. Now, CS, you have 2 questions to respond to today. But during our meeting, SBC meeting, we did see a letter from your ministry regarding question number 063, the one that has been asked by the Senator for Kakamega County. You will, of course, repeat the contents of that letter that you wrote to us, because in itself, that is also a response. So we will first take the questions by the nominated Senator George Mbugwa. After we are done with that, then we will proceed to question number 063. Now, Honorable CS, this is the procedure we adopt during this session. The Honorable Senator who raised this question will first rise to ask this question. I'll call upon you to respond to it. Thereafter, the said senator will have an opportunity to ask you 2 supplementary questions arising from the primary question. He may elect to ask those 2 questions at a go, or he may elect to allow the other colleagues, if any, who wishes to ask any supplementary questions to pose those questions, and then thereafter he may come last in asking a supplementary question. So that is the procedure we are going to adopt. How we then respond to these questions is extremely brief, concise, so that you don't have to give a whole speech, Honorable CS. Straight to the point, concise, and very brief. I will therefore be requesting the Senator George Mbugua, MP, to proceed to ask question number 019.
Thank you, Mr. Speaker, sir. I rise to ask question 19. I would want the CS to tell the House what measures the government has taken to ensure that reproductive health services are accessible to persons with disabilities in compliance with Article 43A of the Constitution, and B, could the Cabinet Secretary provide a list of all the medical facilities equipped with disability-friendly infrastructure and indicate the training programs developed and resources deployed by the government to medical practitioners to ensure they are adequately prepared to attend to persons with disabilities, and C, to tell the House what measures the government is doing to ensure that such services as occupational therapy, speech therapy, and behavioral therapy, which are essential for children with disabilities, are covered by the National Health Insurance Fund. Thank you, Mr. Speaker.
Honorable CS, you may now proceed to respond to that question.
Honorable Speaker and honorable members, I would like to take this opportunity to thank the Senate for inviting me to appear in this plenary and respond to the questions. Honorable Speaker, I would like to begin by first thanking the Senate for their indulgence. I am supposed to have appeared here 2 weeks ago, but I requested to be given time to prepare for the launch of universal health coverage, which we did during Mashujade, and I want to thank the Senate for that understanding. The second, Honorable Speaker and honorable members, I would like to thank this esteemed House for the support, immense support, that you gave to the ministry in ensuring and enacting the 4 bills of universal health coverage that are going to change how we deliver healthcare in this country, and that for the first time as a country, we are going to be focusing and ensuring that the citizens of this country live healthy, vis-a-vis the previous, where we were waiting to repair broken health systems. So I really want to thank the House and the members for that support. Having said that, Honorable Speaker and honorable members, referring to the question regarding disabilities and how they are able to access health services, I would like to respond as follows. Persons with disabilities form a significant part of the world's population, yet as one of the largest groups, their rights are often the least advocated for. The Ministry, in collaboration with relevant stakeholders, is working tirelessly to advocate for persons with disabilities by developing and streamlining disability-inclusive policies and enhancing the ease of accessibility to facilities and services in the health sector. Honorable Speaker and honorable members, the Ministry developed the Kenya Health Sector Strategic Plan 2018-2023 that prioritizes health system strengthening to realize universal health coverage, and has further developed the rehabilitative services and assistive technology strategy of 2022 and 2026 to guide targeted investments to promote access for persons with disabilities. Disability mainstreaming mechanisms within the health systems are ongoing in health facilities to enhance the unhindered safe movements of people with a disability and access to reproductive health services. The Ministry has emphasized on all health facilities, including level 4, level 5, and level 6 hospitals, to ensure the integration of disability-friendly mechanisms to enable the inclusivity of all Kenyans. In the recently concluded Facility Assessment Preliminary Report, the Ministry evaluated whether the health facilities had disability-friendly infrastructures, that is ramps, lifts, disability-friendly washrooms, disability-friendly maternity beds, and wheelchairs, amongst other items. Out of the 12,483 facilities included in the analysis, 47% had at least one disability-friendly infrastructure. 82% had at least a ramp, 54% had wheelchairs, 15% had disability-friendly washrooms, and only 7% had disability-friendly maternity beds. Further analysis revealed that 80% and 42% of level 6 and level 5 facilities had disability-friendly maternity beds, while only 22% and 8% of level 4 and level 3 facilities had disability-friendly maternity beds. Reproductive health and maternal health services are offered in both outpatient and inpatient. The high accessibility in form of ramps, lifts, and availability of wheelchairs indicate that persons with disabilities can access the reproductive services. However, there is a significant challenge in provision of disability maternity friendly in the health facilities. The facility assessment has covered several other areas, and the ministry is packaging the information and will provide feedback to the counties to strengthen access to services, especially in maternal care, by increasing number of disability-friendly maternity beds. In addition to the above assessment, the ministry undertook a short survey of 97 health facilities in October 2022 and found that in addition to the above 4 parameters of access, individual facilities undertook various initiatives to improve access of health services by persons with disabilities. Following are some of the initiatives that have been undertaken. Services are brought to the disabled client, and that is happening at Baringo County Referral Hospital. Availability of staff trained in sign language, that's what is NEST at Bungoma Hospital, and sign language interpreters in clinics and outpatient department for the deaf at Kapsabet County Referral Hospital and Thika Level 5 Hospital. Stretcher bearers were at Kakamega Level 5 Hospital, and 5% of human resource recruited are people with a disability. We have go-karts to ferry people with disability from the gate. There is a rail in walkways, and specifically would like to single out Kericho County Hospital. And again, people with disabilities are provided with houses. Sign language interpreters, motorists, wheelchairs for staff and other officers, disability committee, and braille. This exists at Moi Teaching and Referral Hospital. Honorable Speaker, honorable members, on the second part of the questions, where we need to provide a list of medical facilities equipped with disability-friendly infrastructure and indicate the training programs developed and resources deployed by the government to medical practitioners to ensure they are adequately prepared to attend to people with disabilities. Honorable Speaker and honorable members, in line with the rehabilitative services and assistive technology strategy of 2022-2026, the ministry aims to scale up services to all levels of care, including community-based rehabilitation in line with the universal health coverage and the spirit of leaving no one behind. The ministry has undertaken training of all county directors of health and the disability assessment teams on disability medical assessment and categorization, and further developed the disability medical assessment and categorization guidelines to make assessment standards across the country. Training of county teams involved in disability assessment is done for those who request the national level, and it's done on a need basis. In a significant step forward, the ministry, with support from World Health Organization, is in the process of establishing an assistive technology center of excellence, which will offer training, innovation incubation, research, and development of local assistive products for users. To catalyze the provision of assistive devices, an organization called AT-Scale Global Partnership, the Global Partnership for Assistive Technology, we are working together to strengthen the pathway towards provision of assistive products to Kenyans who need it. The third part of the question, what is the government doing to also ensure that such services as occupational therapy, speech therapy, and behavioral therapy, which are essential for children with disabilities, are all covered by the National Health Insurance Fund. Honorable Speaker and honorable members, the ministry has prioritized training of unique specialists like occupational therapists, speech therapists, and behavioral therapists, and also provides post-skills training development for officers to equip them with better skills to manage patients with disabilities. As the House may be aware, honorable members, His Excellency the President ascended to the law the 4 bills, including the Social Health Insurance Act 2023. This act will ensure that no one is left behind in terms of access to healthcare services. As the Cabinet Secretary of Health, the act mandates me to develop a health benefits package that will cover all components of care, including rehabilitation services. The Ministry is working on the regulations and at the same time reviewing the health benefit package to ensure it is comprehensive and covers all spectrum of rehabilitation services needs with no exclusion. This will definitely reduce the out-of-pocket expenditure for people with disabilities. Additionally, the Ministry is also advocating for community members and households with children with disabilities to come out and seek health services to enable them achieve full potential and full integration into their communities. Honorable Speaker and honorable members, I hereby submit. Thank you.
Thank you, Honorable CS. Honorable Senator George Mugo. Pursuant to Standing Order 51C7A, you have the right to ask 2 supplementary questions. And supplementary question must arise from the primary question. It must relate to the primary question. So you may elect to ask those 2 supplementary questions now, or you may allow your colleagues to proceed to pose questions, and then you come last. Which option are you taking?
Thank you, Speaker. I wish to allow my colleagues to come in faster, then I'll come in later.
Thank you. Senator Wamati.
Thank you very much, Mr. Speaker. I would want to start by appreciating what the Kenya Kwanza government is doing in terms of the health, universal health. Thank you, CS, for that elaborate answer to the question, but fully aware that health is a devolved function. I could have loved to hear you talk about capacity building within the county government so that they are able to undertake those functions that are devolved. Further to that, Mr. Speaker, sir, I would want the CS to tell us what the ministry, in terms of policy, is doing to ensure that the increasing number of mental health disorders, especially among the adolescents, and Nyeri being among the leading counties in men's suicidality, it is an issue that we feel must be addressed both as policy and infrastructure development level. Thank you, Mr. Speaker.
Honorable CS.
Thank you, Honorable Speaker. In my submission, I did indicate what we have done with the counties. As a ministry, we have undertaken training of all county directors of health and the disability assessment teams on disability medical assessment and categorization, and further developed the disability medical assessment and categorization guidelines to make assessment standards across the country. Equally, Honorable Speaker, in the last 2 months, as a ministry, we have undertaken an assessment of all health facilities within the country. We have a preliminary report, and it is based on that report that the ministry is going to put together a strategy on how we work on the gaps that have been identified. Honorable Speaker and honorable members, from my report, we see that we have a long way to go in ensuring that we mainstream disability-friendly facilities within our country, and we shall be putting that in our report to work together with the Council of Governors and see how then the counties can be able to adopt that. Honorable Speaker and honorable members, on the issue of mental health, as a ministry, we have already developed a mental health policy, which we launched, and equally last month, we did launch a mental health and wellness policy at workplace. We have put in place guidelines on how mental health should be handled, and we shall be working together with the county governments to ensure that mental health services are accessible to all Kenyans. But at the national level, we have Mathare mental referral hospital, which I have visited personally, and we have put together a plan to see how we equip it to be able to take care of mental health issues, but most important would be how we work with county governments to ensure that mental health services are available at the community level. But equally, Honorable Speaker and Honorable Members, in the just launched community health, the universal health coverage, we have recruited over 100,000 community health promoters. One community health promoter will deal with 100 households. And one of the issues that they're supposed to be tackling, Honorable Speaker and Honorable Members, is to give education and health promotion. So it is expected that they will also play a big role when it comes to handling issues of mental health at the household level and at the community level. I submit. Thank you.
Thank you. Thank you, Mr. Speaker. Thank you, Mr. Speaker, for this opportunity. Yes, I would want to thank the CS for her presentation. In as much as I'm not fully satisfied, I had a first encounter on Friday with some of the community health promoters in Ekerenyo Sub-County Hospital, and looking at it on issues to do with mental health, I think I need the Ministry of Health to come out clear on what policy or what interventions you have to do with issues of informed consent, because most of the time we assume that people with mental health issues can't make decisions on their own. And past interventions we've seen have had decisions made on their behalf through their guardians or parents. So I really need the Cabinet Secretary to come out and really highlight on what deliberate interventions you're making. Because individually, I don't think the community health promoters I see would have capacity to deal with the issue of mental health as it is in society right now. Thank you, Mr. Speaker.
Honorable CS.
Thank you, Honorable Speaker and Honorable Members. I would like to appreciate and acknowledge the Senator that at least there is evidence that the community health promoters are all around the country, and happy that you encountered one at Ekerenyo Sub-County Hospital. Honorable Speaker and Honorable Members, in terms of consent for mental wellness, it depends on the degree of the mental health at issue. So depending on what degree it is, then a consent is required from a guardian or a parent. But if one is in a position to make a decision, they are allowed to make decisions on their own, especially if they are adults. Honorable Speaker and Honorable Members, on the issue of community health promoters, I would like to emphasize that their work is not to treat or handle the mental health issues that will be in the society. They are supposed, one, to educate, and number two, to make referrals to health facilities. That is their main objective. That should they encounter a case, then they should be able to make referral of that person to a health facility. I submit. Thank you.
Senator Dulo.
Thank you, Mr. Speaker. I wish to welcome the CS and the team. Mr. Speaker, over the years, immediately devolution take off, I remember in this Senate we discussed about standard within the counties. And unless we keep standards within the counties, the level of service delivery is not going to assist Kenyans. How can the ministry ensure that the standards are kept within those counties to make sure that there is proper service delivery and there is proper access to service by Kenyans in those counties? Finally, Mr. Speaker, on UHC, Mr. Speaker, just one...
Senator Dulo, pursuant to Standing Order 51C7B, you're entitled to ask only one question. Honorable CS.
Thank you, Honorable Speaker and honorable members. The issue of standards is a critical issue for the Ministry of Health. And in this current government, we actually have a whole state department responsible for public health and professional standards. So at the national level, we have developed standards, and we do continuous capacity building of officers at the county level. We actually have trained inspectors who are supposed to be looking at the quality at the different counties. Equally, we are building capacity of our regulatory authorities to be able to handle the issues of standards at the county levels. But Honorable Speaker and honorable members, I would like to say that this being a shared responsibility, we have to have a certain level of accountability from the county CEOs to ensure that the standards that we put in place are enforced by their officers within the counties. I submit. Thank you.
Senator Veronica.
Thank you, Mr. Speaker. Honorable CS, welcome once again to Senate, and thank you for the responses you have given. The question you have been requested to answer is sensitive because it deals with persons with disabilities. And Honorable Speaker, what is the ministry policy in working together with organizations and initiatives that are non-profit making, which are adding value to the facilities, medical facilities that are being given to persons with disability? And are you aware of Belarisu Medical Center that is doing cleft lip and palate, and which has speech therapy facilities, and which, if you had an MOU with, you would help a lot of children who have gone through operations on cleft lip and palate? And what are you doing to support such institutions so that they do not fail, but they can use their world-class facility to benefit many more children who have gone through trouble with cleft lip and palate deformities?
Honorable CS.
Thank you, Honorable Speaker and honorable members. One of our approaches in delivering universal health coverage is partnerships with donors, with NGOs, and other non-governmental actors, including civil society, in ensuring that we deliver universal health coverage. What we have done at the ministry is that in the past, most donors, partners have been delivering vertical programs. But it is now at the Ministry of Health, we are putting together to ensure that we work together towards achieving the government objective of universal health coverage and leaving no one behind. Let me acknowledge that I have not personally interacted with the Belarisu, and I'm happy, Senator, that they are dealing with cleft lip and palate surgery. We shall, as we retreat back to the ministry, we shall get in touch with them and see how best we can work together to support them in the work they do. But in the interim, we are working together with all partners to ensure that we leave no one behind in our coverage in our universal health care coverage. Thank you, Mr. Speaker.
Senator Gathuri.
Thank you, Honorable Speaker. The CS has given us comprehensive data on what is not available in the health facilities across the country, and that health is devolved. At what point do you share that data with the county governors? Or is it the report, is it only for the national government that you have it, or the data you are sharing with the county governments so that they can be able to equip those facilities? Or maybe are you in any way suggesting that you'll be proposing conditional grants in the next budget so that you can give the county governments to equip the facilities? Thank you.
Honorable CS.
Thank you, Honorable Speaker and honorable members. As I said earlier, that delivery of healthcare is a shared service between the national government and the county governments. Honorable Speaker, in the last 2 months where we did the level of service assessment, this exercise was undertaken together with the county governments. And in all the health initiatives that we undertake, we do it jointly with county governments, so that one, data is shared immediately, that they are able to know the results of the assessment that has been done. Honorable Speaker and honorable members, as I said earlier, we shall be sharing a final report on the gaps that were identified. I want to believe, Honorable Speaker and honorable members, that then gives this House an opportunity in advocating for more resources to county governments to be able to bridge the gaps that we identified during the report. And I want to thank the Honorable Senator for proposing conditional grants to county governments to be able to deal with the gaps that shall have been identified. I submit. Thank you.
Senator Mandago.
Thank you, Honorable Speaker. I want to thank the Cabinet Secretary for appearing and answering these questions, Honorable Speaker. Honorable Speaker, my concern is on the response that the CS has given, particularly in rehabilitative services and assistive technology for persons with disability. Honorable Speaker, my question to the CS and Ministry is, we know before you are able to successfully help these persons living with disability, the first thing that needs to happen is a proper assessment so that the assistive devices that are given are then appropriate. I would like to know the position of the ministry in regards to establishing proper assessment centers in this country, Honorable Speaker. I'm aware the only assessment center that government has is the one available at the Kenya Institute of Special Education. But considering that is used for assessment and training, therefore it limits the availability of that facility for purposes of assessment. What is the ministry doing to ensure we have at least, if not in every county, every region, a proper assessment center so that persons with disability can be able to access? Honorable Speaker, I'm asking that question because we once in my county did an assessment of children with hearing impairment, and we had a total of 3,000 children who were brought for that assessment. To our other shock, 2,300 of those children could actually hear with just an hearing aid being provided. But these are children who have missed to go to school. These are children for the last 10, 15 years they have not been hearing. They are hearing for the first time when they are over 10 years, and their lives has been made difficult because of failure to have the assessment facility. I would like to know the position of the ministry on that matter.
Honorable CS.
Thank you, Honorable Speaker and honorable members. I acknowledge the question. Previously, assessment was only at one level, at the ministry. But right now, the assessment has already been devolved. So each county has a team, multi-stakeholder team, multidisciplinary, that has been trained to do assessment for disability. And I am informed that this has been happening now for the last 2 years. And we continue to build capacity of those multidisciplinary teams at the county levels to be able to do assessment. But equally, we have assessment being carried out at all the level 6 facilities, which are 6 in the country. So on the 47 plus 6, that means that then we have a total of 53 assessment places where assessment of disability can be done. The ministry, however, continues to do appeal cases where an assessment has been done in the county and the person is not satisfied with the results. The Ministry of Health at the national level, we work on the appeal cases. I submit, Speaker.
Senator Meru.
Thank you very much, Honorable Speaker. And I thank the CS for a very elaborate answer to the question. And I actually went to consult Senator Mbugua because he's the man that sought the question so that I am able to ask a question that is relevant. And my question to the Honorable Cabinet Secretary. Last week, Honorable Speaker, and allow me from the onset to thank you that you allowed us to do the red ribbons in celebration of the Dyslexia Week last week, Honorable Speaker. And I'm very saddened, Honorable Speaker, because in my opinion, I did not see anything. Or anyway, let me ask it as a question. What did the Ministry of Health do for creating awareness on dyslexia? Because you know, Honorable Speaker, dyslexia is a condition that has many times been misdiagnosed. Senator Mbugua and I attended that particular celebration at the Kenya Institute of Special Education, which again, Honorable CS, is important to note that you and your ministry was not represented. At least Parliament was represented because Kedipa was there, but the ministry was not represented. I did not see them doing anything in terms of awareness. And also finally, I would want to know whether the Cabinet Secretary is aware that 100 kids that have this condition of dyslexia do not have a school to attend in January because the Kenya Community Center for Learning that has been taking care of them has been, Senator Mbugua is well aware of this particular challenge. They have been driven out of the place that they have been using as a school for the last about 5 years. At least the other time they were helped by Kedipa, but we have not seen the ministry do anything in terms of supporting children living with dyslexia. Honorable Speaker, one of the very talented kids that was presenting in that dinner that the ministry was not represented was actually is the best swimmer in Kenya. He got an award of being the best swimmer in Kenya. She's from Nyeri. And when she first went with her mother to hospital, she was misdiagnosed to be a person that has a mental challenge. So tell me, Honorable Speaker, a person with a mental challenge is the best swimmer in the Republic. So the misdiagnosis of dyslexia is a big problem, and I would have expected the ministry to join the whole world last week in creating awareness.
Honorable CS.
Thank you, Honorable Speaker and Honorable Members. I appreciate Senator Meru for bringing out the issue on dyslexia as one of the disabilities that do exist. Honorable Speaker and Honorable Members, as a ministry, we follow the World Health Organization calendar of celebrations of specific days within the health sector. And dyslexia is yet to be put in the World Health Organization calendar of days to be celebrated. However, we continue to provide and create awareness in the day-to-day activities. But I would also like to say that as a ministry, we would like to take a whole of health approach, that we are not highlighting just one of the disabilities and celebrating or creating awareness around it, but rather looking at the whole area of how do we mainstream disability into the health sector and the health services. Having said that, Honorable Speaker and Honorable Members, it has been acknowledged that children with the dyslexia, if not identified early, then they may not reach their full potential. And I want to acknowledge the one that has been highlighted by the Senator as being the best swimmer. So we want to acknowledge and say that as a ministry, we are really going to work with the 100,000 community health promoters that we have trained, that they should be able to identify these cases early so that they are brought out, so that then alternative ways can be devised on which the children can be assisted to reach their full potential. I submit.
Senator Boni.
Thank you, Mr. Speaker. Mr. Speaker, allow me to congratulate the Minister for successfully midwifing the launch of the universal health care Mr. Speaker, it looks like it was always going to be a woman minister who would preside over this process, because I recall you and I, in the good old days, it is when Charity Ngilu was minister that she came up with this attempt to have universal health care. So I congratulate her. Having said that, Mr. Speaker, the minister is aware that one of the need that is required by people living with disability in as far as access to reproductive health care is concerned is that a large percentage of them require assisted delivery, the mothers. They require surgery. And the biggest impediment, Minister, is the cost of access to that surgery. Do you have a policy in the same manner that you have for children under 5, so that when these people these women living with disability, when they go to the healthcare place, they are not denied charges because they cannot afford? Thank you.
Honorable CS.
Thank you, Honorable Speaker and Honorable Members. Indeed, I do acknowledge that women with disability require assisted delivery. As the government, we have 2 programs. One is Linda Mama, which takes care of all women in terms of delivery. And actually, it begins from them being able to attend clinics, delivery, and even after delivery, they are able to attend clinics. This financial year, Honorable Speaker and Honorable Members, the government put 4.98 billion for support of Linda Mama. Secondly, we have government subsidy, health insurance for people living with severe and disability, that they are able to access health services. But having said that, Honorable Speaker and Honorable Members, one of the acts that was enacted is the Social Health Insurance Act. And in that act, we have developed benefit package to ensure that every person is taken care of. Those who are unable to pay, the government is going to work on a program to ensure that they are able to pay for them to be able to access services. Equally, in that Social Health Insurance Act, we have the Primary Healthcare Fund that ensures that all primary healthcare, level 1 to level 3, is publicly financed, to mean that people will not have to pay any out of pocket to access services. I submit, Honorable Speaker.
Honorable Boy.
Asante sana Mheshimiwa Spika kunipa fursa hii. Kwanza Mheshimiwa Spika, nataka toa shukrani zangu za dhati kwa Waziri wa Afya kutupatia fursa sisi watu wa Kwale. Kama seneta wa Kwale pia natoa shukrani kwa niaba ya watu wa Kwale. Siku ya Cancer Awareness Day ilisherekewa katika kaunti ya Kwale nchi nzima, yani jumla katika hiyo siku ya Kwale, yani Cancer Awareness Day katika Kenya ilisherekewa katika kaunti ya Kwale, Msambweni Referral Hospital. Yangu kwa niaba ya watu wa Kwale natoa shukrani yangu kama seneta wa Kwale na gavana wangu kwa waziri kutupatia fursa sisi watu wa Kwale kwa siku hiyo kusherekea na sisi pamoja. Asante sana waziri, asante sana.
Honorable Senator, you are supposed to ask a question, not to render your appreciation. Senator Tabitha.
Thank you, Mr. Speaker. And let me start by really congratulating the CS for the great job that he's doing. And as a female leader, we are very proud for our female leaders in the Kenya Kwanza government, especially on the bill that was passed recently. Thumbs up, and that's very great. My concern, my question, Madam CS, would be still on the CHVs in terms of their duration of contract, and also in regards to the kits that they are supposed to have, because we've noted that some of them do not have, they are not fully equipped, and also in the very remote areas, Some also do not have the same kits. And I know the county that I represent, that is Nairobi, we still have some shortages. So I would want to know what framework, what mechanisms have you put in place so as to ensure that there is total facilitation and equipment of the same personnel so that they are able to deliver their services. And just quickly on autism, which is a disability, what is your take on the cost of the medicine that is normally undertaken by these patients, because the cost of medicine is very high? Thank you, Mr. Speaker.
Honorable CS.
Thank you, Honorable Speaker and honorable members. I want to appreciate the accolades from the Senator of Kwale. It was a very nice experience to be in Msambweni to launch the Cancer Awareness Day. Honorable Speaker and honorable members, I would like to highlight that the community health promoters, Senator, we now call them promoters, not volunteers, do not have a contract. One is that these community health promoters are identified by their communities. After being identified by their communities, they are taken through training, both by the county and at the national level. And we have an agreement with the county governments that we are going to give them a stipend. We are going to co-match that we give 50% while the county governments give 50% of a stipend. And that is more of an appreciation, so we do not have written contracts with them. But we have community health assistants that then supervise them to ensure that they are carrying out their duty, and those community health assistants have contracts with the county governments. Honorable Speaker and honorable members, we did launch a total of 100,000 community health promoters. And before we did launch on the 20th, 3 weeks before that, His Excellency the President had flagged off equally 100,000 kits, to mean that each of the community health promoter has a kit that is fully equipped with the items that we have put in there to be able to address the issues within the community. But after the launch, Honorable Speaker and honorable members, we have received feedback from the counties that not all community health promoters were covered within the 100,000. We have received a total, we have put together a total of 20,000 across the county of community health promoters. We are going to put them through training, and after the training, then they shall be given the kits so that they are able then to carry out the work that we have asked them to do. On autism, Honorable Speaker and honorable members, autism is a developmental disorder affecting children, and management involves many interventions, especially medications and behavioral therapy that is being worked on. However, I would like to say that in the new acts that we have now, under the Social Health Insurance Act, we are developing a benefits package. This benefits package, our plan is that it should include everyone, all services that are required. There are no exclusions, there are no limits within that. So it is our hope that as we finalize with the regulations and we go into implementation, no one is going to be left behind. Whether with autism, whether in any other form of disability, we should be able to take care of all of them under the essential benefits package that we have developed. I submit.
Senator Kinyo.
Thank you, Mr. Speaker. From onset, I want to thank the Minister. But, Mr. Speaker, having said that, I am aware that we have many community health workers in this country. And I want to say that's a good thing. Comparing it to Cuba, you can only say that in many places in Cuba, we have what we call polyclinics, Mr. Speaker. And these community health workers do a good job. But, Mr. Speaker, if you look at our republic, we say that resource must follow functions. Much of the resource is left at the national level, Mr. Speaker. And when we have these community health promoters, if they diagnose or they have issues with the people they are seeing, they refer them to the health centers, Mr. Speaker, as well as the dispensary. What really frustrates is that when you go to our health centers, Mr. Speaker, and our dispensary, there's no medicine, Mr. Speaker. So the purpose is defeated. Unlike in Cuba, where they say that they are health workers. In fact, they call them the army in white coats. Mr. Speaker, what I wanted to hear from the minister is that what is their program? Like, Mr. Speaker, because many of our counties that we have, they don't have resources. As far as they have been given so many functions, but the resources are left in the national government, Mr. Speaker. I don't know what the minister would be doing. Like, for example, we have these community health volunteers.
What is your question,
Mr. Speaker? My question is, Mr. Speaker, how are they assisting the counties, Mr. Speaker? Because they have limited resources, because much of the resources, Mr. Speaker, are left at the national level. We don't have equipments in the county government, Mr. Speaker, like, for example, in health centers, where the community health workers are responsible, Mr. Speaker.
Honorable Sears.
Thank you, Honorable Speaker and honorable members. Specifically for the community health promoters, we required standardization and consistency. So at the national level, we are the ones who have undertaken training for the community health promoters. Equally, the kit was funded by the national government. We are also giving them gadgets, smartphones, so that they are able to collect data real-time, data that will be used for decision-making in the health sector. That is an investment by the national government. The stipend, 50%, is an investment by the national government. But having said that, Honorable Speaker and honorable members, I did say that 2 months ago, we did a level of service assessment. From the level of service assessment, we have a report that indicates what are the gaps within the facilities in the counties. Notably, we have big human resource for health gaps. We have big gaps on health products and technologies. So we are working together with the county governments to derive a mechanism on which we are able to fill these gaps. But, Honorable Speaker and honorable members, in the enacted laws, the Social Health Insurance Act has a primary healthcare fund. And this primary healthcare fund is supposed to ensure that all facilities at the primary level, that is level 2, level 3, are funded to ensure that they have human resource and they have health products and technologies. You will recall again, Mr. Speaker and honorable members, that one of the laws that was enacted is the Facility Improvement Fund. The Facility Improvement Fund is supposed to ensure that funds for the county, for the health facilities, are ring-fenced and replowed back into health facilities so that then they are used to ensure that there are no gaps in service delivery. So as currently we are working on the regulations, and we should be able and ready to go by in the next maybe a month or 2 months, and then we shall be advising Kenyans on what we are going to do in terms of meeting the gaps that do exist. I submit, Honorable Speaker.
Senator Mario.
Thank you, Mr. Speaker. My question to the CS, to what extent and how are PWDs and their representative organization involved in designing, planning, implementation, and evaluation of health policy and programs?
Honorable CS.
Thank you, Honorable Speaker and honorable members. Honorable Speaker and honorable members, as we are aware, stakeholder participation is enshrined in the law. And therefore, we do involve people with disabilities when we are developing policies at different levels during public participation. Having said that, Honorable Speaker and honorable members, at the Ministry of Health, we have officers who are living with different disabilities, and they are involved in drafting and in working on the policies that we do make. I submit, Speaker.
Honorable Senator Ogwa, you may now ask your supplementary question.
Thank you, Mr. Speaker, and thank you, CS, for those elaborate answers. I have two clarifications I would want you to make. One, on the disability-friendly infrastructure, you indicated that the maternity is the least equipped at the level of 7%. I would want you to speak more on this because we've had so many cases of women with disabilities losing their lives at the time of delivery. And two, among the interventions you indicated that have been made at these facilities is the employment of at least 5% of persons with disability. I would want you to speak more on the success of this at the facilities and also at your ministry as a whole in this requirement of employing 5%. Thank you.
Honorable CS.
Thank you, Honorable Speaker and honorable members. In terms of the infrastructure, it is indeed true that it's quite low for maternity services, and therefore it's one of the things that we shall be working together with the county governments in filling the gaps that do exist. But Honorable Speaker and honorable members, we must acknowledge that infrastructure development is capital intensive. So it is not going to be a day, a month. It is going to be over a long period of time because there has to be serious budgetary allocations for us to be able to fill the gap on infrastructure. On employment, the 5%, as a ministry, we are continuing to ensure that more people are trained to be able to carry out these services. And as and when they graduate from the trainings, then they should be deployed adequately. But as it stands now, the 5% is low. But the only way is to ensure that we have more people trained to be able to handle the different forms of disability that do exist. I submit, Speaker.
Thank you. We will now move to question number 063. This is a question by the Senator for Kakamega, the Honorable Boni. Kindly proceed to ask your question.
Once again, thank you, Mr. Speaker. Mr. Speaker, could the Cabinet Secretary disclose the initial cost of the project for the construction of the Kakamega Teaching and Referral Hospital as was awarded by the county government of Kakamega? State how much of that amount has been paid to the contractor so far and indicate the percentage of construction works undertaken so far. B, what are the reasons behind the stalling of this project? C, what measures will the government take to secure the construction site and put an end to the ongoing vandalism and theft of construction materials, including equipment? Finally, Mr. Speaker, what is the government doing to execute the presidential directive that the national government takes over the stalled project? I thank you.
Honorable CS.
Thank you, Honorable Speaker and honorable members. Thank you, Senator Boni, for that question. Honorable Speaker and honorable members, thank you, Speaker and honorable members. Schedule 4 of the Constitution of Kenya distributes functions between the national and the county governments. Under the national government, we have the referral health facilities, which are 6 that are fully, that the national government is fully responsible for. Kakamega County Referral Hospital, from our records, is categorized as a level 5 hospital under the county government of Kakamega. The stall project for the construction of the Kakamega Teaching and Referral Hospital was designed and constructed by the county government of Kakamega, which we had hoped that they will be given, they will have sent in their response so that I'm able to respond conclusively to question 63A to C. So as it is, Honorable Speaker and Honorable Members, I'm not in a position to respond comprehensively to Part A, B, and C. Having recognized that, I wrote to the Governor of Kakamega County on the 25th of October, and in my submissions, I have attached the letter that I wrote to the Governor, asking him to provide responses to Part A, B, and C of the question, so that then I can come with them to this House. And I indeed copied the Clerk of the Senate my letter requesting for response. But as to my coming here this morning, we have not received any response from Kakamega County, despite several follow-ups. So, Honorable Speaker and Honorable Members, I would like to request that the Kakamega Governor is asked to come and respond to the questions or send the responses to my ministry so that I'm able to respond to it. Having said that, Honorable Speaker and Honorable Members, on the last bit of the question, the reference is made to the presidential pronouncement regarding the support towards the completion of Kakamega Teaching and Referral Hospital. The pronouncement indicated that resources be allocated to cater for purchase of medical equipment for 100 million Kenya shillings in the supplementary budget of October, and 200 million to be allocated for civil works for completion. Honorable Speaker and Honorable Members, the 200 million allocation was based on availability of funds to be given to Kakamega County. So far, these funds have not been availed by the National Treasury, and we await for them to avail the funds, then they can be dispersed to Kakamega County. Having said that, Honorable Speaker and Honorable Members, we are working on a program to equip the Kakamega County Referral Hospital and other hospitals that have major equipment gaps. And the promise or the pronouncement by the President of 100 million shall then be fulfilled once we are equipping other hospitals. But it's important to note, Honorable Speaker and Honorable Members, that we can only equip a hospital that has been finalized, that construction must be complete for us to be able to equip the hospital. So we shall be waiting at that point. When that is done, then we shall be putting in the national support of 100 million shillings towards the equipment. I submit.
Senator Boni, do you have any supplementary question?
Mr. Speaker, I hear the minister, but maybe this is testament to why calling ministers to Parliament was an act whose time had come. Following the pronouncements by the President, President Uhuru, former President, to that effect, and subsequently President William Ruto to the same effect, Minister, what has happened in Kakamega is that the county government has pulled out of that hospital. The construction has stopped. Security for the project has been removed. And now what is happening, Minister, is that there is vandalism both from employees of the county government and members of the public at a great cost to the public. Could you undertake in this Parliament that you will not shift the responsibility to us, but that you will go to the ground and see for yourself, so that you agree in the spirit of interdependence and interrelation with the county government on how to secure the project, protect the equipment that had been brought there by the suppliers, and actualize the pronouncement by the president to the public that the institution is being elevated to level 6 and the national government will take responsibility thereafter. I request that you consider what I'm saying seriously, because if you don't, 6 months from now or less, there will be no hospital. And the investment runs in billions of shillings. Mr. Speaker, I prefer not to ask a question, but just request her to do slightly more. And I'm willing to cooperate with you. We go together so that we can rest this problem.
Thank you, Senator Boni. If I got the CS correctly, what the national government did was give a very precise assistance in form of 200 million. The national government never indicated that they're going to take over this facility. So matters of securing the facility cannot be put on the shoulders of the CS. Matters of the construction, having stalled, cannot be put on the shoulders of the national government. The national government promised to assist the Kakamega County government with 200 million, which 200 million is yet to be availed. So as the county is waiting for this money, it is upon and it's a responsibility of the county to make sure that this property is fully secured. However, Honorable Sears, being the policy holder in matters health, what do you say about the request by the Honorable Senator for Kakamega?
Honorable Speaker and honorable members, let me first clarify that in the previous government, the governor of Kakamega, Governor Oparanya, had written to the ministry and requested the national government to take over the facility. And therefore, at that point, then the national government would have been at 100% responsible for completion and ensuring that the facility then operates as a level 6. However, Honorable Speaker and honorable members, when we came into the office, I followed up that letter with the Kakamega current governor, Governor Barasa. And he did indicate to me, I have been to Kakamega on 2 occasions, and he did indicate to me that they were not going now to hand over the facility to the national government for it to be a level 6 facility. However, they were going to operate it as a level 5 facility. Honorable Speaker and honorable members, based on that, then the role of the national government is to assist the county government to ensure that they complete the facility and run it as a level 5. But having listened to the honorable senator, having visited the project myself on 2 occasions, that project is huge. And I will put together a team, a multidisciplinary team from the ministry. We'll seek the senator's support that we go and highlight the issues to the honorable governor, paint the bigger picture of not just completion, but equally of running the facility. And hopefully then that we can get to an amicable solution on how we assist the counties. But as it is, its responsibility lies squarely with the county government of Kakamega. I submit.
Senator Mandago.
Thank you very much, Honorable Speaker. My question to the CS. I've had a response on the issue of Kakamega Hospital on delineation of function. My question to the Cabinet Secretary would then be, why is the ministry then building a maternity facility in a Kerenyo sub-county, which is also a devolved function? So I think we then want to know if there is really that clear delineation of functions, then why is the ministry going to perform functions that are supposed to be performed by the county government of Nyamira?
Honorable Sears.
Thank you, Honorable Speaker and honorable members. Thank you, Senator Mandago, for that question. The responsibility of health is shared. between the national government and the county governments. Honorable Speaker and honorable members, as we sit today, I have requests from 42 of the 47 counties for support of facilities at different levels. So, based on availability of resources, some from partners, some from donors, some from the national government, then we allocate resources based on the requests that we have received. So Ekerenyo did submit a request, and they are receiving that support. We are evaluating the other requests that we have received, and based on availability of resources, we are always willing to support the county governments to ensure that all Kenyans have access to health services. I submit.
Senator Gloria.
Thank you, Mr. Speaker. Perhaps a follow-up question is there a methodology of prioritizing the requests? Because from what I hear from Senator Halwale, there is a dire situation in Kakamega of a pending project, and that seems to me as a request as well. So maybe if we can be given a methodology of how the requests are prioritized, so that people might not think that there's an inclination of just political goodwill on one side and not the other side.
Honorable CS.
Thank you, Honorable Speaker and honorable members. Yes, there is a prioritization criteria. Mostly is based on the need of the populations, and two, the level of investment that is required. So where there's a need, there's a huge population that needs a health facility, and the level of investment is not that high, and the resources are available, then that project is prioritized. The case of Kakamega, you will agree with me, Senator, it is a huge project that requires billions to finalization. And it is not just Kakamega. Even my own county, Trans Nzoia, needs resources to finalize their referral hospital. So based on availability and equally the cooperation of the respective governors to be able to work together with the national government on completion of their projects, I submit.
Senator Kenyo.
Mr. Speaker, mine is not a question, but just an observation, Mr. Speaker. When she did say that she's
Senator
going to, she's just...
Kenyo. Senator Kenyo.
Mr. Speaker...
Please ask a supplementary question. If you have none, just...
Okay, Mr. Speaker, the good Cabinet Secretary mentioned that she's going to set a multidisciplinary committee that will look at the issue of Kakamega Hospital. Mr. Speaker, my request is that we would request if she can include our good chairman of the Committee of Health, Mr. Speaker, so that he can assist our good senator of Kakamega. Thank you, Mr. Speaker.
Thank you. You need not respond to that. It's not a question, as the senator said. We need to conclude this, Senator Boni. What say you?
Mr. Speaker, thank you for your indulgence. This is not for the minister, it's for you. Given the opportunity I had, understanding Order 53(1), which I lost because I preferred to go the question way. And it is quite clear that the minister feels the governor, not feels, the governor has appealed to the national government that he doesn't want to release the project, contrary to what his predecessor had done, contrary to what we had made the president to pronounce himself to when he visited the county. Could you allow me, Mr. Speaker, with your indulgence, that you direct the Committee of Finance? The Committee of Finance is in Kakamega next week to look at the state of the roads project. If you could pronounce that they carry this matter, and if possible, you direct the Committee of Health to also join us, because the project we are talking about is over 5 billion shillings, and 5 billion is going down the drain. It cannot be right just because of, could it be with the national government or the county government? Let's get the project going, whether it is superintended by the national or the county government. I request that you consider that, even if necessarily now, but you can make the pronouncement later, before next week. We are supposed to go there on 9th for the roads.
Senator Boni, this is a house of rules and procedure. You have not lost your right under Standing Order 53. Indeed, you can request for a statement, which then can be committed to both standing committees, that is the Committee on Health and the Committee of Finance and Budget. The CS has not substantively dealt with 2/3 of your questions because they fall squarely within the ambit of the devolved unit, that is Kakamega County. And therefore, we cannot say, because the matter has been asked to the Cabinet Secretary, it cannot be asked to the Health Committee. And therefore, if you still feel inclined to pursue this matter through the committees, all you need to do this afternoon is to lodge in your request for statement. It will be processed, and it will be committed to the two committees, and by next week, you'll have the committees in Kakamega with full mandate, because they will have been committed to their hands.
Thank you, Mr. Speaker. I'm so grateful. But let Hansard reflect that the potential loss of these billions of shillings and loss of project and the consequences to the people of the region is because of trade unionism in the Council of Governors, Mr. Speaker, because they feel that the national government wants to take away duties that they would like to discharge.
Senator
the
Boni,
County of Government of Kakamega is not able to discharge, Mr. Speaker.
Senator Boni, you'll make that statement when you get to Kakamega. That's a better forum, not the plenary. Honorable CS, let me take this opportunity to thank you for availing yourself for purpose of responding to these questions. You are now free to leave to do what you're supposed to do. And thank you for the good work that you're doing. You may leave. Now, the next question is the question by this is the question by Senator Joseph Kamau Murango. I don't seem to see the said senator. I'm told the senator had nominated Senator Veronica, who is supposed to relieve me, and therefore he's going to further nominate another senator for purposes of responding to these questions. Senator Veronica, you may actually proceed to do that because the Deputy Speaker is going to relieve me now.
Thank you, Speaker, Honorable Speaker.
Just give us a minute.
Honorable Senators, I want to now welcome the CS of Public Service, Performance and Delivery Management CS Moses Kuria and your team. Welcome to the Senate. There is one question only for you from the Senator for Kirinyaga County, Senator James Mwangaza. And this question will be asked on his behalf by Senator Veronica Maina. You can have your seat as CS. Let her ask the question, and then I'll give you the opportunity to give you your reply. Senator Veronica.
Thank you, Honorable Speaker. I ask this question on behalf of Senator James Mwangaza, Senator for Kirinyaga County. Honorable CS, what criteria is used by the ministry to categorize and gazette areas as hardship zones in the country? And could the Cabinet Secretary state why Mwea constituency in Kirinyaga County has not been gazetted as a hardship zone, considering the adverse conditions in most parts of the constituency? And B, when does the ministry intend to classify Mwea constituency as a hardship area in order to compensate public servants who serve in the region under adverse conditions? Those are the two questions.
CS, I can see you have a comprehensive response, but because of the time, maybe you can see how you can summarize.
Thank you, Mr. Speaker.
I know your intellect capacity of summarizing so many issues, so this should be one of them.
Mr. Speaker, thank you, and honorable senators. The Ministry of Public Service, Performance and Delivery Management appreciates the role of the Senate in terms of providing oversight, which ultimately makes us a better public servant. Mr. Speaker, in response to the question by Senator for Kirinyaga, Senator Joseph Kamau Mwangaza, on what criteria is used by the ministry to categorize and gazette areas as hardship zones in the country, and on whether as to why Mwea constituency in Kirinyaga County has not been gazetted as a hardship area, considering the advanced conditions in most parts of the county. In terms of the criteria used, Honorable Speaker, the first criteria is availability or lack of it of food and accessibility to food, an availability and inaccessibility or otherwise of water, transport and communication service in terms of adequacy, social services, whether they are available or accessible, climate conditions for that particular area, and the terrain harshness of that area, and security or high possibility of security threats in a particular area. And finally, Mr. Speaker, is severity of poverty. Mr. Speaker, Mwea constituency has not been gazetted as a hardship area because the government is addressing the challenges of the existing disparities in designated hardship areas across the public service, and has undertaken a study to review and harmonize the designated hardship areas across the public service. Gazettement of the hardship areas and implementation of the designated hardship areas will be undertaken upon approval by Cabinet, and this matter is currently before Cabinet. Mr. Speaker, as to when the ministry intends to classify Mwea constituency as a hardship area in order to compensate public servants who serve in the region under adverse conditions. Mr. Speaker, the government is addressing the challenges of the existing disparities in designated hardship areas across the public service, and has undertaken a study to review the same and harmonize the designated hardship areas across the public service. Gazettement of the hardship areas, implementation of the same is currently under consideration by Cabinet and with guidance from the Salaries and Remuneration Commission. Mr. Speaker, I submit.
Thank you, CS. Senator Veronica, you just have your seat. Mr. CS, you can have your seat. Do you want to ask the two supplementary questions now, or maybe I give a chance to a few senators, then you can come in?
Give the chance to a few senators, then we can ask, clarify.
Senator Wamatinga Waume. Yeri, Senator.
Thank you very much, Mr. Speaker. Let me start, Mr. Speaker, by congratulating the CS. He has a way of whichever docket he gets, then he shines in it. My question goes in the same note of this National Youth Service, where he pronounced himself that he'll make it a kind of a military outfit. I have some few willing men who would want to do the same. Maybe he can outline that, how he's going, especially in the marginalized areas, to ensure that indeed even youth from there access the services. Thank you, Mr. Speaker.
Yes, you can just make your statement on that.
Thank you, Mr. Speaker, and thank you, Speaker for Nyeri. Indeed, Honorable Speaker, we have pronounced ourselves on the new direction for the National Youth Service. The re-engineering agenda of the National Youth Service, which we are undertaking, is premised on 4 key pillars. The first pillar is the pillar of paramilitary training and regimentation. This is important because we have to impart on our young people with the right social, patriotic wiring so that they become good citizens capable of driving the country forward. Mr. Speaker, as we speak, currently we have got around 10,000 servicemen and women serving under the paramilitary service within the National Youth Service. By end of this financial year, we are going to recruit 20,000 youths, and then in the year 2024-25, we go to 40,000 youths, 25-26, 60,000 youths, and ultimately get to 100,000 youth by the year 2027. Honorable Speaker, the second pillar, and before even I leave on the first pillar, is on the issue of regimentation. Regimentation, simply put, Mr. Speaker, is that we put these youth under clusters, just like it happens within our disciplined forces of the police force, of the military, so that they can be able to work together and cross-socialize each other with positive behavior and patriotic angling as we prepare them to be better citizens. Honorable Speaker, the second pillar of our engineering agenda within the National Youth Service is what we are calling contribution towards national service. Mr. Speaker, we have a lot of opportunities within government where our youth can be used to offer those services. As you speak, Mr. Speaker, tomorrow we will be in Kitale, in Trans Nzoia County, with the Cabinet Secretary for Agriculture and our National Youth Service, where we have up to 6,000 acres of maize that is ready for harvesting that would have otherwise gone to waste from the Agricultural Development Corporation and the Kenya Seed Company. 5 million kilograms of seed that would have actually gone to waste. And tomorrow, we will be descending on that particular area with hundreds of youth who are going to harvest that maize, prevent it from going to waste, and therefore save money and time and a lot of resources while actually helping the country to in terms of food security. As you know, we are coming from a season of very debilitating hunger. The reason I'm giving that example, Mr. Speaker, is just to give you an example of where can you expect to find the green uniform. You'll find them in our farms, doing the farms. You'll find them guarding our offices. You'll find them planting our trees. You'll find them cleaning our markets. You'll find them even in areas that we don't have a lot of experience, like mining and blue economy. We want to engage our youth to offer services to other government departments as part of this national service. The third pillar, Mr. Speaker, we cannot do that unless we impart upon our youth vocational and technical knowledge. So our third pillar is on vocational and technical skills, which we are going to accelerate. We are already doing that to teach them and train them in some of these areas where we expect them to offer national service. Finally, Mr. Speaker, is on the issue of commercialization of the National Youth Service. Even for our county governments, for our private sector, for our members of parliament, National Assembly through CDF, you can expect that going forward, the National Youth Service, through what we are setting up, National Youth Service Enterprises, is going to offer the same service which private sector is offering. The only difference is that we can get these jobs on a G2G basis with other state corporations, with county governments, with the national government CDF, with the GAF and all other bodies, with international, even going out there, because the issue of youth unemployment is so serious, is so urgent, it is actually the biggest threat we have to our security and our long-term prosperity as a country. And so therefore, the National Youth Service is going to be not the only, but the major catalyst to solving the problem of youth unemployment. I submit, Mr. Speaker.
Thank you, CS. Let's get another supplementary question from Senator Dedito John Kenywa.
Thank you, Mr. Speaker, for giving me this opportunity, and I want to thank the Cabinet Secretary, Moses Kuria, for the way he has elaborated the question posed by Senator for Nyeri. Mr. Speaker, I want him to clarify what is the unit that he uses to put as a hardship area, Mr. Speaker. Is it constituency? Is it county? Is it sub-county, Mr. Speaker? I'm saying that because, Mr. Speaker, you can come to a constituency which is true. Some part of that constituency has got what is impossible to get food, Mr. Speaker. There is insecurity, Mr. Speaker, and we have impassable roads, Mr. Speaker. But equally, in the same constituency, Mr. Speaker, you have the opposite of the same. There is no problem with security. The roads are good. There is plenty of food, Mr. Speaker. So I wanted to know what unit are they using? Because, Mr. Speaker, the correct unit from where I sit is sublocation, because that's the smallest unit, Mr. Speaker, of administration in the Republic of Kenya, Mr. Speaker. Because if you talk about the constituency, Mr. Speaker, it will be unfair for some people who will be getting the benefit of getting hardship allowance, Mr. Speaker, while others are not getting the same, Mr. Speaker. I wanted that clarity, Mr. Speaker.
CS, respond to that as well.
Honorable Speaker, I appreciate the question from Senator from Laikipia, and I do understand why he would be very much concerned about that, because Senator of Laikipia comes from a county of disparities with some very productive area which can feed this country, and other area which depends on relief food from some area which literally translated means comfort yourself, because there's nobody to comfort you, an area called Uyomereri. Honorable Speaker, the way we have clarified the areas, we are using the location as the lowest unit. I appreciate that we need to go lower on the sublocation. We'll keep on revising. In the first phase, we are going to, the guidance we are going to release are depending on the location. I totally subscribe to the view that we need to make the sublocation to be the lowest unit because of the disparities we have. And second thing, there's nothing stopping us from it. There's nothing difficult. There's no rocket science to it. We have got sublocation data now within our Huduma system, the census that we took. It is possible for the Kenya National Bureau of Statistics to give us data all the way to sublocation level. My request and my view is once we do this, because I'm going to do it, then probably you need to treat us all equally and ask the people who are doing also the equalization fund to follow suit and do it at sublocation level. I submit, Mr. Speaker.
Thank you for the elaborate response. Now, Senator Bugwa George.
Thank you, Mr. Speaker. Let me first welcome and congratulate the CS and welcome him to the Senate. He's a man I've known for the better part of my life, and I'm sure he's going to do a good job in his new docket. Mr. CS, we are talking about hardship area. You've talked about scarcity of food. I am aware that the National Youth Service own large tracts of land all over Kenya, including Samburu County, and that land is idle. I would want you to appraise this House what plan you have on commercialization of this idle land so that we can help the country in solving the food problem. At the same time, CS, I would want you to tell this House what plans you have for people with disability joining the NYS, because we are only recruiting the able-bodied, and somebody like me, and you know me for a very long time, you cannot recruit me. Thank you.
I'm not sure whether you want to join the National Youth Service or you are talking on behalf of the other young men who are born differently. Honorable CS.
Thank you, Honorable Speaker. Honorable Speaker, I appreciate the question from the Honorable nominated Senator George Mugwa. You can expect, Senator, that the biggest farmer in this country will be the National Youth Service. We are going to utilize all our existing land, including the land in Samburu that you've talked about. Tomorrow, because of the partnership that we'll be launching with the Ministry of Agriculture, the Agricultural Development Corporation, Kenya Seed Corporation, we are also going to discuss with them how they will also will release land from them in areas like Garana, Kulalu, and you can expect that the next big provider, supplier of food, of maize for the local market and for the export market is going to be the National Youth Service. Honorable Speaker, we are discussing with the county government to deploy the National Youth Service. We have got counties which have already given us land to do seed propagation within the counties, to move from the current system where our counties, our farmers in the counties are expecting seedlings to be supplied from Nairobi, which I find not acceptable because it's the other way around. We have started with the county of Siaya, where the governor of Siaya has offered 70 acres to start a seed propagation farm in Ugenya constituency for this purpose. Mr. Speaker, we have come from a situation of famine, of hunger, of food scarcity. In my considered opinion, this need not be the case. We need to have some intervention from government to complement what our hard-working farmers are doing. And it is my commitment to the country that through the National Youth Service, we'll be able to match our especially subsistence farmers and our medium-sized farmers, especially in the North Rift. The total output from farmers on individual basis is going to be matched one-to-one by the National Youth Service so that we have got a reliable source of food. Mr. Speaker, within the next 2 to 3 years, you can expect that National Youth Service is going to assist the country either working alone or even through public-private partnership, working with foreign partners to be able to do food production. there has been a lot of interest, Mr. Speaker, from foreign investors who would want to come and do agriculture and help the country to be self-sufficient in food production and as well to have food for export. What they have been looking for, and I know that from my previous assignment, is a worthy partner who can be able to partner with them to be able to farm together because of local knowledge and the local situation. The National Youth Service is going to enter into partnership with the international investors to come and work with them. They bring in their capital, they bring in their equipment, we bring in our labor, we bring in our local knowledge and satisfy this country in terms of food availability and food security, and also earn this country foreign exchange through food export. Mr. Speaker, the second question from Senator George Bugwa on the people who are specially abled. It is a policy of the National Youth Service to reserve up to 20% of all the recruitment to people who are specially abled. And especially now, because of the commercial activities we'll be undertaking, some of them can be undertaken very properly by people who are specially abled. We have even some people who are specially able now working with our garment and apparel manufacturing unit at the National Youth Service, which is already providing the bulk of the uniforms that our police, our Kenya Defense Forces, our Kenya Wildlife Service Rangers are using. They are already being made from the National Youth Service. We are going to expand on that as we do all these activities, including business process outsourcing, where we have agreed with the Kenya Revenue Authority. Recently, you saw Kenya Revenue Authority recruit some revenue service agents from across the country to work with people, taxpayers, to expand the tax base. And National Youth Service has been requested by the Kenya Revenue Authority to undertake this service on behalf of the Kenya Revenue Authority, thus providing even much more opportunities for our young people. And in doing so, we're also going to establish a very huge back office to support bodies like Kenya Revenue Authority. We have got the custom scanning, which they are ready to give to us. Ministry of Lands in terms of digitalization of lands records. We want to work with judiciary. All these are people who can give us jobs, which can be done not only by people who are able-bodied, but also people who are of special ability. And I want to assure you that Senator George Bugwa, if I receive your application to join the service, I will give it consideration, given we were together from high school. The only thing is that it's unfortunate that you are past the age of being recruited there. I submit.
Next is Senator Oloba Magoma Gloria.
Thank you, Mr. Speaker. First of all, let me take this opportunity to congratulate our CS, Moses Kuria, for the new appointment. Many don't know that he contributed during his time in his former ministry to really help rally people to support the cause of period poverty, and I appreciate that. I have a follow-up question in terms of the commercialization of the National Youth Service. For purposes of clarity, because it's a question that has been asked, is there a policy that gives a certain percentage to the National Youth Service a priority in terms of national projects? As you have told us that now the National Youth Service is being called upon by KRA, by different other entities of government. But I'm wondering if there's an actual policy that says that a certain percentage, same way we have AGPO ring-fencing 30% to a certain constituency of enterprises. And actually, CS, the other reason I ask this is we know we as a government, as the Kenya Kwanza government, we have promised to deliver certain things such as 100 dams. And if you look at the cost of using the National Youth Service against the cost of going out to procure services from other commercial entities, we actually save a lot. So if there is a policy, maybe you can highlight that. And then National Youth Service, as it is being commercialized, I suppose that the idea is to make it one of the biggest employers. That way we can deal with the crisis of our youth not having jobs. If that is the case, is there also a policy or some structure in terms of growth within National Youth Service so that, you know, the last opportunity that came about, I was calling upon youth and asking them, there's an opportunity to join National Youth Service, but there seems to be some negative form that National Youth Service doesn't pay well or doesn't pay at all. So maybe that's something that you can also highlight and make us aware if there's growth within the National Youth Service as an employer.
Yes, Honorable CS.
Thank you, Honorable Speaker. Honorable Speaker, I appreciate the question from nominated Senator Gloria Roba. In terms of the policy for ensuring that we have got some ring-fenced allocation for the National Youth Service in the national service jobs, that policy is currently being worked on by my ministry in conjunction with Treasury and with the guidance from...
Senator, sorry, Honorable CS. Senator Chalage, you know this is not your farm in Nandi. This is the Senate. You cannot just crisscross the way you want. And you are a ranking member in this House. Proceed, Honorable CS.
Honorable Speaker, as I have said, the policy is currently being worked on. We have got a team that is working on both the policy and putting up proper structures for setting up of the NYS enterprises. This effort is being led by none other than His Excellency the President, the Presidential Economic Team, my ministry, and Treasury. As we speak also, we have got a committee of up to 11 principal secretaries that we have set up. Each principal secretary giving us an indication of the jobs available in each state department. We have some early successes in agriculture, as I've mentioned, in irrigation, in the dams, as the Senator has mentioned, in offering security services in our buildings. Really very promising and a very exciting time for our youth. So the policy that we are working on in conjunction with putting up the framework for affirmative action along the lines of AGPO is going to go a long way in ensuring that through the National Youth Service, we are able to absorb many more young people, impart them with the right skills, give them some meaningful work, and ultimately release them to the market in a way that they can be able to be more employable, or even to create some entrepreneurs out of them so that they can also employ other young people. Honorable Speaker, on the question of the upward mobility for the National Youth Service, because this is a very pertinent issue. Honorable Speaker, we are working on mobility in several ways. One, already, you remember there was an instance where the Kenya Defence Forces ring-fenced 300 positions to be filled up by graduates or from the National Youth Service, and 10,000 of them turned up for the interview. We require now to bring in police and KDF to maintain security. That was a pointer of some, the situation as it is, and what we are doing now, we are sensitizing people from a security sector to use the National Youth Service as a career progression when they are recruiting. We have had early successes on that. Subject to availability of budget, the National Police Service is going to recruit a cadre of 3,000 policemen and women coming exclusively from the recruits coming from the National Youth Service. The Kenya Wildlife Service has already approved within its board, upon our request, to recruit in the next 2 months 1,500 servicemen and women for the Kenya Wildlife Service, who will be recruited exclusively from the National Youth Service. We are also working to expand our Huduma centers, which also fall within my ministry, from the current 53 to a minimum of 1,000, and each of them providing a minimum of 5 jobs for the young people of this country, so that also that becomes another breeding ground for youths who are better for the future. So in a nutshell, Honorable Speaker, we are now using the outreach and sensitization method as we work on a policy and ultimately into a law that is going to actually ensure that we give some quota mandatory to the National Youth Service as we create upward mobility for our young people. Mr. Speaker, let me finish by mentioning that Kenya School of Government, which is also within my ministry, we are working with them to ensure that we create some higher qualification for young people who excel within the National Youth Service to be able to be trained by Kenya School of Government so that they can now also join the mainstream civil service, and we give them the first right of refusal or acceptance, because everybody in this country deserves a chance. I submit, Mr. Speaker.
Thank you, CS. Honorable Mariam Sheikh Omar.
Thank you, Mr. Speaker, sir. Mine is on recruitment, CS. Recruitment of National Youth Service. I realize marginalized counties, specifically northern Kenya, the numbers is 0%. 2% or 1%. Is there a criteria on your is there a criteria you are using so that we be equal to 47 counties? Thank you.
CS.
Thank you, Honorable Speaker. I appreciate the question from the Honorable Senator. The policy and framework of recruitment is based on the location level. So you will never find a location in this country where you don't have somebody getting an opportunity from the National Youth Service. What there is that some areas, they don't want to join the National Youth Service. My advice to them is National Youth Service is now the gateway for you to join our discipline forces, to join our public service, and if I have my way, and supported by this parliament, I'll even make it mandatory for anybody working in the public service to first of all go through the National Youth Service and Kenya School of Government. So I'm happy to get any details of any particular location in this country which has never had any opportunity. And should that come to my attention, that is not a matter of policy. It is either the youth did not turn up to register to join the National Youth Service, and if it is for any other denial of that opportunity, I commit to this House to do thorough investigation and to take the remedial action. I submit, Mr. Speaker.
Thank you, Honorable CS. Senator Chalagay Samson.
Thank you, Mr. Speaker. From the onset, I want to congratulate Cabinet Secretary for Public Service Performance and Delivery Management for being appointed to this docket. CS Moses Kuria. Mine is just is to find out from the CS emanating from this question. In case, because I've seen his response, in case he will gazette which criteria, and I've seen the parameters. Mr. Speaker, you are aware we normally use a Commission of Revenue Allocation formula, and even we pass conditional and additional funds to marginalized wards. For example, here in Kiambu, in Deia, in Kiambu County, should be benefiting from that additional funds, for example. In Nandi, a place like Terik Ward, Chepterway Ward, although in Kapchorwa, Soba Songa, and Chemelil Chemas ward benefit, but Kapsimat ward does not benefit. To many people, Nandi County might look that it's a land of honey and milk. So what strategies as the CS and how long will it take, Mr. Speaker, to classify and ensure all civil servants, including teachers and other government employees, are able to be given hardship allowance, Mr. Speaker, so that they benefit from this process, and also ensure, Mr. Speaker, that they work together, because Senate is a protector of devolution, with the CRA formula, Mr. Speaker. And Mr. Speaker, the issue of NYS, finally, I had the CS, because it's one.
You know, you have
it's
only one supplementary.
It's one question. It's joined. I'm just finishing
There's
it
no
up.
way
It's joined.
hardship allowance can be equated again to NYS.
I'm developing so that I find out, so that from the CS,
They are not
maybe, Mr. Speaker, in quick succession, with your indulgence, is that the CS had promised the nation that he is negotiating with National Police and KDF to ensure that the NYS recruit who undergo parliamentary training service to be given priority in recruitment. Mr. Speaker, can he give a commitment that he has going into the future of site recruitment? I thank you, Mr. Speaker, for the indulgence.
Honorable CS.
Thank you, Honorable Speaker. The question from the Senator for Nandi. The question is very pertinent because indeed some of the places that he has mentioned, like Karai Ward and Deya Ward, locations within Kiabu County, and in fact Terik location within Nandi County are in the draft proposal to be included, that is currently undergoing cabinet approval. Mr. Speaker, the good thing is that this draft already has undergone through public participation, so there was comprehensive public participation to be able to get the views of the public, and I also want to fully support what Senator Nandi has said, that, and I had mentioned it in my opening answer, about the need to harmonize all these formulas. I have a formula because of something called hardship allowance. Somebody else has something called for enhanced allowance. That is the Teacher Service Commission. CRA has got another definition for another purpose. Somebody else has got a definition because of the equalization fund. Somebody else has it because of drought mitigation. So I agree, and I'm going to work with my colleagues within the executive so that you can have one definition that is coherent across all uses, so that you don't have people defining hardship, for their own expediency. In regards to the discussions we're having with the Kenya Defence Force, National Police Service, and other discipline forces, KWS, Kenya Forestry Service, indeed now this has been embraced by all these formations under the leadership of His Excellency the President, that National Youth Service needs to be the catchment area for the future from which anybody who is going to join our discipline force is going to come from. Let me just give one of why this is important. This is important because if you take a youth who has gone through 6 months of paramilitary training by the National Youth Service, by the time they get to Kiganjo for the police training, they will cut the training time from 9 months to 4 months, thus saving on cost and ensuring that you can deploy faster. So there is even a justification. It's not just a favor. There's a justification, there's a value proposition that it makes much more sense to recruit from the National Youth Service because they have already been trained, they have been gone through the basic drills that they would otherwise have gone to if they would have joined from day one from these discipline forces. I submit, Mr. Speaker.
Honorable Senators, we should be now concluding the issues with the CS public service. Let us have the last two, and then I will call upon Senator Veronica Maina to ask a supplementary question. Senator Mandago, Jackson.
Thank you, Honourable Speaker, for the opportunity, and thank you, Honourable CS. My question to the CS, supplementary question in regard to equal opportunity in public service, is that, Honourable Speaker, we are seeing a trend in recruitment in public service that is worrying and a threat to cohesion of this country. Honourable Speaker, in all the recruitments that have happened recently, we don't see equity in the distribution of the available position, creating a serious frustration in various young people in the country. Honourable Speaker, I would like to know from the CS, Public Service Management, on the recently advertised about 8,000 internship positions through the Public Service Commission, how they are going to be equitably distributed across the country. Honourable Speaker, from my small mathematics, if they are to even distribute per constituency, every constituency in this country will receive at least 30 slots for internship in public service. We would like to see equity in recruitment of public servants across the public service, Honourable Speaker.
Honourable CS.
Honourable Speaker, let me appreciate that question from the Senator for Uasin Gishu County. Honourable Speaker, indeed the issue of equity and equitability in the distribution of available employment opportunities in the public sector and in public service especially has been a matter of concern. It has been expressed severally, especially in the recent few months, and indeed is an issue that I am seized of. Honourable Speaker, our Constitution vests the mandate of recruitment of public servants with the Public Service Commission. Public Service Commission is an independent constitutional commission, has got the unfettered sole responsibility for this recruitment. We are working very closely with the Public Service Commission to achieve two things primarily. First is to ensure that we have got a fair allocation of all existing positions across the country. Of course, not equally, because there are other considerations, for example, population, that have to be factored in. But to have a formula that is scientific, that is measurable, and that is visible out there, that is coherent, that is defensible, that is understandable. So that one, we want to give that commitment, and I have the commitment of the chairman of the Public Service Commission that that is a risk that we owe this country. The second thing that we want to achieve, Honourable Speaker, is on the issue of transparency and visibility. We have a slogan we have given to this, using the language of the young people. We are calling it Jobo Bila Connection, that it is possible for any young person in this country to aspire to work for any government department, in ministry, in state corporations, in a university, in any other institution in the public sector, and have the same opportunity as somebody else. You do not have to know someone, you do not have to be connected to someone. That is why we are coming up with a digital platform where all these jobs will be posted. And even the allocation of these jobs within that platform will be distributed up to the location level. That way, if you come from Ngenda location, where I come from, and you try to apply for a job that is for somebody from Uasin Gishu County, you cannot apply, because that job will be reserved even within the technology for somebody from that particular county, and that will be audited, and that's verifiable. So digitalization of this recruitment process is very key, so that also we can share these results. Anybody can log in and see it publicly, that in this location they got 5 slots, whether for jobs or for internship. That's why we are saying, for you to access this job digitally, you need an internet connection. That is the only connection you need to get a job, not connection to someone. I submit, Mr. Speaker.
Senator Joe Nyutu. Senator wa Murang'a.
Thank you, Mr. Speaker, for the opportunity to also place my question to the CS Public Service. And if you allow me, I would want to first congratulate him on the posting to this new ministry. And wish him well, even as he cuts and cultivates a new image of a CEO far from the image of a politician. Mr. Speaker, I would want, having said that, to ask the CS whether he is aware that there are some teachers or trainers, if you may, serving in technical institutes. But these are teachers that are employed by the Public Service Commission, different from their colleagues who serve under the TSC. And Mr. Speaker, knowing and understanding that TSC is a body mandated with the employment and management of teachers, does the CS think that his ministry is competent to deal with the teachers? And does he think that the teachers that are serving under the PSC should remain there, or for the welfare of the teachers and the institutions that they serve, whether they should be surrendered to the TSC? Mr. Speaker, that is my question to this Honorable CS.
The Honorable CS.
Honorable Speaker, I want to appreciate that question from the Senator from Mwangaza. Honorable Speaker, as I have mentioned, recruitment to the public service is the constitutional body for the Public Service Commission. Public Service Commission is an independent commission under our Constitution. Recruitment of teachers and management of the human resource affairs of our teachers is the preserve of the Teacher Service Commission. Teacher Service Commission is also another independent body, indeed a constitutional commission. The rules are very well defined by the Constitution. Unless the Constitution is amended, our lanes are very well defined. My role is defined in terms of developing policy and handing over that policy to the Public Service Commission. We work independently, but interdependently. We don't work in isolation, we don't work in silos. We consult from time to time. And I believe that from my ministry to the Public Service Commission, Teacher Service Commission, the Constitution demands of us to work together even if we are independent. Independence is not existing in isolation. So we are mandated to work together, and we do consult from time to time. Let me also mention that Senator Mwangaza has talked about the image of a CEO, not the image of a politician. If I am asked to choose which image I want the image of a politician, because only a politician understands the problem of this country. Only a politician knows that people go without food. And when I go to Mwangaza, I hear people of Mwangaza saying, no Nyutu, no Nyutu, no Nyutu, means I have to take him very seriously. I thank you, Mr. Speaker.
No. No, what is your, no. You know, a CS cannot be out of order, but maybe what you want is maybe to put it in English, what he meant by no Nyutu. But because he is not on the floor, let me interpret for you. When he gets to Mwangaza, people usually say it is Nyutu, it is Nyutu, it is Nyutu. That is no Nyutu. Yeah. So, Senator Veronica Duarte Maina, ask you a supplementary question as we conclude with the CS.
Thank you, Honorable Speaker. And I want to take this opportunity to thank the Honorable Cabinet Secretary for the intensive answers that he has given to the question that was brought by the Senator for Kirinyaga County. I will ask one question, or maybe it has two questions in one. First, I have looked at the data that you have given in your response and the statistics that are being used, especially for the Ministry of Education, was the legal notice of 1997. So it has designated about 44 areas, hardship areas, and increasingly with the climate change issues, the adverse effect of climate change, the ravaging effect of climate change has caused many areas to fall within the category of hardship zones. And if I would cite one as an example, Honorable Cabinet Secretary, is an area called Ithanga, which is in Gatanga, which is a very dry area and would meet all the conditions that are set down as parameters that you weigh, that are weighed before an area is declared a hardship area. And that is just one example. And places maybe like Meru and many other places, Honorable Cabinet Secretary. Now, CS, the delay or the slow pace at which these areas are being declared will eventually mean that they cannot have targeted programs even to make interventions that would make the areas better, not just for the public servants, the public service employees, but also for other intervening programs that would then help the areas to attract resources that then helps to alleviate them from the hardship zone, from the red zone to a better zone. What is your ministry doing to ensure that the review of what the hardship areas is done in a timely fashion and to match the ravaging climate change effects? Because if the review is slower than the effects of the climate change, then are we being fair to those regions that have fallen within the hardship areas, but then years have passed and there is no decision yet from the cabinet designating those areas as hardship zones?
Honorable CS.
Thank you, Honorable Speaker. Honorable Speaker, I appreciate that question from nominated Senator Veronica Maina. Honorable Speaker, indeed, it's not acceptable that this process has taken 1 year. It is my commitment that within the next 3 months, this process will have gone through cabinet, will have been concluded, so that indeed the disparities that the Senator has talked about are addressed. It is not hardship areas. It is also an opportunity for even those areas that have ceased to be hardship to be declassified. You know, some situations have changed. Economies has improved in those particular areas. We've got some very rich areas which are still existing as hardship area, and they need to be removed so that we give way to some areas which now also qualify to be termed as hardship area. So that is what we are doing. That's my commitment, Honorable Senator, that within the next 3 months from today, that is by the end of the month of January, this matter will have been dispensed by cabinet and it will be gazetted and implemented. Honorable Speaker, I don't know if I'll get another chance to put my closing remarks or I can.
Sorry, the right time.
Okay. Let me take this opportunity to thank this House, this Honorable House, this dignified House for giving me this opportunity. And let me finish by saying that we are all public servants and all of you are under my control. If you have not received your salary, you know, I would very much interested to know if you have got any welfare problems. All the 900,000 of us who work in the public service are my business. It's a very fulfilling job, knowing that ultimately we work for all other 54 million Kenyans. And I'm trying to transition our public service from being an arena or a source of public employment. A lot of us are saying we are in public service. No, we are just in public employment. We need to transition from being in public employment to being in public service, so that you can be able to serve this country better. Honorable Speaker, my docket also includes a State Department for Performance and Delivery Management. Simply put, it is my responsibility. If government is not performing, it is me to be held accountable. If you're not delivering on our projects across whichever ministry, from fisheries to camels, from water to air, wherever they are, performance and delivery are my business. And so therefore, I want to encourage this House to call me many times. If you have any problem with any ministry or state department, then I'll do what I must do. Thank you, Honorable Senator. Thank you.
Thank you, CS. CS, you know, you are one person who is very flexible indeed. And you joined the ministry just the other day, but the way you understand what is happening in the ministry is fantastic. The NYS, about the handship issues, it's like maybe you knew that you'll be transformed to that ministry, so you started learning about the ministry, maybe the first time you were appointed in trend. So thank you very much for your time and for your good response. I think transforming public service is what is really needed in this country. And this House will support you in whatever way we can so that you'll be able to perform. And all the best in your endeavors. Senate is your friend. There is a time you are told you don't appear here when you're in train, but now you can see you are the best friend of the Senate. So tuko pamoja kwa kazi yako. Asante sana waziri. Honorable Senators, the business appearing under number 8 has been deferred to the next time, so we are now on order number 9.
Order number 9, motion, repossession of movable assets by lending institutions due to non-performing loans.
Is Senator Wamatinga ready to move the motion?
Yes, Mr. Speaker, I am ready.
Yes, go ahead.
Thank you, Mr. Speaker. Indeed, I've waited for some time to be able to move this motion. I'm happy that today I have the opportunity. Mr. Speaker, sir, I beg to move the motion that aware that in the high unemployment rate in Kenya has pushed many Kenyans to seek loans from SACCOs, microfinance institutions and banks to start small business and medium enterprise to sustain their livelihood. Noting that the youth in particular have invested in movable assets, including vehicles and motorcycles, to start business in the transport industry, and most of them have signed up to the ride hailing applications, including but not limited to Uber, Taxify, Bolt, and Little Cab. Convinced that the Banking Act of 2015, Cap 488, does not provide for renegotiation on the loan repayment agreement whenever the business environment becomes unfavorable, and as a result of the high cost of living, lowered earnings from the app providers and high interest rates. Now, therefore, the Senate urges the National Treasury and Economic Planning to come up with a policy framework to review the Banking Act in order to renegotiate the repayment terms of the loans and provide caution for Kenyans with non-performing loans and prevent the loss of their movable assets. Mr. Speaker, sir, we are all aware that we've come from a very hard economic time. That, we're coming at the backdrop of the COVID, has seen many Kenyans, their income opportunities dwindle by the moment. Mr. Speaker, sir, we have a highly educated population which is composed of a large part by young Kenyans who have endeavored to get jobs and have been unable to get those jobs, and therefore, being enterprising as they've been, they've decided to start their own enterprises, and the only option they have, because of the unfavorable banking institutions we have in this country, they've resorted to borrow money from microfinances and from other circles so that they can sustain their lives. Mr. Speaker, coming from 4 seasons of drought and COVID, Kenyans' purchasing power has gone down. However, we have not seen the government come up with a framework, both in terms of banking policy, to be able to cushion the loss of assets. We are all aware that most of the banks and these finance institutions have moved up with speed to recover or to the assets from the young people and from the Kenyans, which they hold by the auctioneers, forcing the young people and the Kenyans at large to go again to the microfinance and mostly even to the Shylocks to get money, come pay for that. What is very unfortunate, Mr. Speaker, is that even the time that those assets are held, that they cannot use them, they are required to pay for those months, they are required to pay higher interest rates, they are required to pay penalties, and most unfortunate is that they are also required to pay storage facility for those movable assets. Mr. Speaker, sir, we must as a country agree that we have educated quite a big number of young people. They have acquired degrees, they have acquired skills. What we have not been able is to generate enough employment. Therefore, Mr. Speaker, it is important that as a nation, we come up with policy, including Enterprise Development Fund, that will be subsidized by the government, so that these young people who want to create alternative employment for themselves and their colleagues can have a support from the government. Unfortunately, Mr. Speaker, what we see is that the banks will move with speed. Once they are not able to repay, once they default in the second installment, they go assess the assets, they go store them with the auctioneers, and most unfortunately, as I said again, the owners are required to pay both for the installments, to pay for the storage, and then, Mr. Speaker, you know it is against the rule of natural justice to have to punish somebody for the same offense multiple times. They are forced to pay interest, higher interest, they are blacklisted, and most unfortunately, Mr. Speaker, their ratings in credit, in terms of credit reference, are also lowered. This is a multiple punishment for the young people. Mr. Speaker, sir, as a country that is looking forward to attract investors in the country, we know charity begins at home. We must start by creating opportunities for our own youth who have been trained through taxpayers' money, give them opportunity, and most importantly, also set up institutions that will work up with them in terms of incubation, in terms of management services, in terms of providing them with the professional financial advice that they need so that they can sustain their businesses, instead of seeing to it that the banks and the financing institutions are more than eager to repossess what they had provided for. Mr. Speaker, it is an open secret, especially in the border sector. Almost 90% of the borders in our road, almost 90% of the taxes that in our roads have been financed through financing arrangements that are very, very unfavorable to the investors, that are mishap as it is today. The economic meltdown have seen most of them unable to repay, and therefore they end up being repossessed. What is very, very unfortunate, Mr. Speaker, we have seen some of them even paying more than 70% of the cost, including the interest, and still they are repossessed. At the end of the day, Mr. Speaker, some of these young investors are forced to pay multiple times the cost of the asset that they are having. It has forced them into a vicious circle of poverty that if we, as a country, we do not do anything, then they'll never get out of it. Mr. Speaker, sir, it is an open secret that most young people are falling into depression because of financial crisis that has been created as a result of a system that is insensitive, especially the banking sector, totally insensitive to the challenges that are arising. We have seen the cost of loans going up every day. We have seen the loans become access to money market becoming complicated for people who do not have collateral to put into the banks. Mr. Speaker, sir, it is the high time we look at our Banking Act, and we must remodel it in such a way that we must be aware that most of the bigger population of Kenya do not have access to title deeds. They do not have access to collateral that are required by the bank. And therefore, we must restructure and remodel it in such a way that it will be attractive to the young people, to the young enterprising investors whom we can be able to support, who can be supported through a channeled and an organized structure like it used to be in the formative years of this country, when we have ICDC, where you could work with a proposal, get financing, get advice, and get in incubation, and most importantly, also get access to the market. Mr. Speaker, sir, it is unfortunate. We have trained, as I said, many youth, but we do not have job opportunities. I am happy just a few minutes ago that the CS Public Service has detailed how he's planning to do with our youth. But Mr. Speaker, sir, it is important to note that not everybody can be a position in formal employment. And therefore, it is paramount and imperative that we also create alternative options where people can be able to learn into. And that will start with friendly financing services, supportive policies, and most importantly, avoiding exploitive financial institutions which have come in the name of microfinancing, but what they are indeed, they are milking Kenyan dry, they have become Shylocks, they are giving assets to the youth and to the young Kenyans in the pretext of wanting to help them, but what they are doing, Mr. Speaker, is exploiting them because the Banking Act does not regulate some of these things. Mr. Speaker, sir, if we want to negotiate some of the misfortunes that we've gotten as a country, not being able to create enough employment, the effects of having capital flight from the country, the effect of seeing migration of investors from our country to the neighboring countries, we must start by addressing the Banking Act the way it is. We must start by putting the framework, both in terms of policy and legal, to ensure that even young investors who access bank loans can be able to do business without being charged unproportionately high interest rates and unfavorable terms and conditions of the loans. If the government does not intervene, Mr. Speaker, sir, most of the young people are condemned to lose their assets, to lose their money, and we have seen young people, young family break up because of the financial crisis that these young investors have been forced to, not because they are not good enough, not because they do not have business acumen, but simply because we fail to put policies and framework in place that will be supportive, especially in the harsh economic environment that we are faced with. Mr. Speaker, sir, we have seen in many countries, Ghana being included, where young Youth Enterprise Development Fund has been set up, where young investors can access loans and credit without having to pay the 20% interest, because even the businesses they do, Mr. Speaker, cannot make 20% profit. Some of them are working with 7%, 8%, at most 15% profit. Therefore, Mr. Speaker, sir, it beats logic. How do we expect them to break even when we know that the interest, the cost of the money is far much higher than the profit that they are going to make? Mr. Speaker, sir, as if that is not bad enough, we go ahead and put punitive measures in place through these institutions which are regulated. Once the people default to pay, the second month their assets are repossessed. Mr. Speaker, sir, if anything, we have to be fair. The immovable assets like houses cannot be repossessed, and once you default, they are put under receivership, the money is collected and continue to service the loan. Unlike in the immovable assets, in the movable assets, Mr. Speaker, we see the auctioneers come, repossess, they charge you the money to store the things, but at the same time, you're still supposed to pay the money that you're supposed to pay monthly. I ask myself, where do these banking institutions think that you'll get the money if they're holding the assets that you're supposed to generate money from, but yet they want you to pay? This is like double punishment. I think it cannot be fair in the eyes of the law that you, for the same thing, you are punished multiple times. Mr. Speaker, we are talking about creating the future of a young generation, but it cannot be created if the laws that we have in place are very punitive. They do not encourage, to the contrary, they discourage people who are enterprising even to come up with ideas that they can invest. Mr. Speaker, sir, we know agribusiness is the future and the backbone of this country, but without giving an infrastructure, policy framework, and having the legal framework in place to ensure that once a young person engages in such a business, they are cautioned from the exploitative practices that we have from the banking sector, that we have let it go the way they want. They run the sector without the regulation from the government. And therefore, this is why if you look in every newspaper, Mr. Speaker, you will see money, mobile money being announced. People have gotten into these loans. They are unable to get out of it. They get every day deeper and deeper into debt. Mr. Speaker, that is one of the explanations why mental health among the young people is increasing, the issues are increasing. That is why the rate of suicidality, that is why families are breaking, because we as a government, we in the leadership have not put in place the right procedures, legal framework, policy framework to ensure that those young people who do not have the business experience but have the acumen to dare take the risk, they are not protected from the exploitative banking sector, which every day wakes up only to issue money which is charges as much as 5% per month, Mr. Speaker. There is no business that can make up to 300, 400% profit in 1 year. But yes, we let them charge the same, expecting that these young people we've trained and telling them and promising that this country belongs to them, we deny them the opportunity to build their tomorrow. It is the high time now that we come with the policies and put the legal framework in place and urge the Treasury and the Ministry of Finance to come up with procedures, with policies, with framework that will ensure that young enterprising people can take the risk without ruining their life, Mr. Speaker. With that much, Mr. Speaker, I beg to move and request Senator Gloria to second. Thank you, Mr. Speaker.
Senator Gloria.
Thank you, Mr. Speaker. I rise to second this motion of repossession of movable assets by lending institutions due to non-performing loans. Mr. Speaker, one of the reasons that the Kenya Kwanza government introduced the Hustler Fund is because of the bad culture that we have from the lenders in Kenya. And that culture is what we are discussing in this motion. The culture of actually setting up Kenyans for failure. Mr. Speaker, you have seen numerous agencies who are recruiting, who are advertising for jobs, and then you see tens of thousands of Kenyans showing up because there are no jobs, Mr. Speaker. The only way we can create jobs is by being intentional about the environment to run businesses. Creation of jobs can only come by setting up enterprises. To set up an enterprise, Mr. Speaker, one requires to have capital. For our youth to be to get engaged in social enterprises or any kind of enterprises, they need capital. So of course they are looking up to these lenders, these banking institutions, and hoping that through that capital where they are buying the assets to set up the businesses, that they are able to create jobs for other youth. So, Mr. Speaker, it is very sad when you see repeatedly businesses that are even less than 6 months being auctioned. As a matter of fact, there's a joke that we have with some of my colleagues that the businesses that are being set up in Kenya are auctioneering businesses. We have more auctioneers than we have actual enterprises. To an extent where there is a publication earlier in this year that all the auctioneers were busy trying to fight for space to gazette all the things that they're auctioning. But no one is there to buy because there is no, the economy is not at a good place. So, Mr. Speaker, if we are going to be intentional in terms of setting up these businesses, then we definitely have to review the Banking Act 2015 Cap 488 to allow for renegotiations of those loans that are not performing, to allow that the first point of once you've defaulted cannot be that you are being auctioned and then again you are actually being charged for the interest, being charged for the storage. If you go to Kiambu Road, Mr. Speaker, there are so many kayaks that are just sitting there with vehicles receiving what they are calling storage fees of people who have defaulted on loans. And sometimes you find that it's numerous of these vehicles are actually attached to businesses. Someone went out, got a government tender, they were doing supplies or mapping or something like that. They were anticipating that they are going to be paid in a year or 2 years or maybe even 6 months. They take up, if you go to Kiambu Road, you'll find a lot of these double cabins because they need vehicles that are going to help them to deliver in that business. And then, because of delayed payments from the county government, because of delayed payments from the national government, they default on the loans. And what happens? They now have to think, how do I facilitate the payment of these assets that I took just purely so that I can run business? So, Mr. Speaker, if as a country we have also gone to our own debt, to the people who gave us loans, the Chinese, and we talked to them and asked them to restructure our loans because we are not able to pay as they were, then we should also allow for Kenyans to have that ability or that possibility in the event that they default. There should be some room for renegotiations, and that should be embedded in law. It should not be about the goodwill of an institution. Because as we stand now, they'll tell you some banks don't take a loan there because you'll not be able to renegotiate in the event that you are unable to meet your monthly payments. Mr. Speaker, I also think the issue of job creation, because as I have said, is attached to enterprises. Enterprises are attached to, setting up enterprises are attached to capital. Capital can only be gotten from somewhere. Hustler Fund, when it came in, and I'm really hoping that by the time the Hustler Fund financing of assets is rolled out properly, they also look into this issue of renegotiation, because other than the bad culture, other than the bad culture they are trying to cure of these lenders, of repossessing assets and things like that, it is also an issue of the credit reference, the ratings of your ability to take up any other loan in another institution. Mr. Speaker, there are so many people who actually would rather not even indulge into setting up businesses because of the fear that the little that they have and that they own will be taken away from them. So, Mr. Speaker, if we are not setting up enterprises, for sure we are not being intentional about dealing with job creation. Mr. Speaker, as a government, and as the Kenya Kwanza government, we have seen many defaulters of even taxes being given the leeway to be able to set up a plan to now pay. If you go to many institutions, including KPLC, there are so many people who have pending bills, and what happens is, as the Kenya Kwanza government, we are actually sitting down and saying, okay, fine, you cannot pay the full amount, but let us get into a payment plan. So then why are we not being intentional about amending this Banking Act of 2015, Cap 488, to ensure that Kenyans have the same leeway? Mr. Speaker, I think I have exhausted the fact that this is no longer an issue of, it's not a luxury. We need this to happen because we need to start. In fact, if auctioneers are listening, auctioneers will tell you, even for them, business is not good because they repossess and they charge for storage, but even the people they are charging are not able to pay for those fees because they are unable to recoup that money from the people who have actually taken those loans. So if you think about it, it's a never-ending cycle of nonsense that we need to deal with by amending this act. And I think as a country that is trying to move this economy from one place to the next, I think we need to be intentional from legislation on how we are going to ensure that the environment of setting up businesses and sustaining the businesses is actually improved. So, Mr. Speaker, I beg to second this motion, and I hope that my colleagues can see the sense in it. And I hope that I'm a former member of the Committee of Delegated Legislation. I hope that they can also interrogate some of the regulations that we have there in terms of the banking acts, and because they come hand in hand with the regulations. Because while we are amending the act, it would maybe the fastest way to remedy this problem would also be through engaging the various ministries and seeing whether we can actually amend those regulations that are existing. Thank you, Mr. Speaker.
Thank you, Senator. Honorable Senators, I propose the question that aware that the high unemployment rate in Kenya has pushed many Kenyans to seek loans from SACCOs, microfinance institutions, and banks to start small, medium enterprises and to sustain their livelihoods. noting that the youth in particular have invested in movable assets, including vehicles and motorcycles, to start businesses in the transport industry, and most of them have signed up to the ride-hailing apps, including but not limited to Uber, Taxify, Bolt, and Little Cab. Cognizant that the Banking Act 2015 Cap 488 does not provide for renegotiation on the loan repayment agreement whenever the business environment becomes unfavorable as a result of the high cost of living, lowered earnings from the app providers, and high interest rates. Now, therefore, the Senate urges the National Treasury and Economic Planning to come up with a policy framework to review the Banking Act in order to renegotiate the repayment terms of the loans and provide cushion for Kenyans with non-performing loans and prevent the loss of their movable assets. Senator Osotsi.
Thank you, Mr. Speaker, for this important opportunity to also weigh in on this motion, which is to repossession of movable assets by lending institution due to non-performing loan. Let me start by thanking the mover of this motion, Senator Wahome Wamatinga, for bringing this very timely microfinance institution and banks to start businesses in transport. Mr. Speaker, many of the people who are affected in this case are border. And you will acknowledge, Mr. Speaker, that border is a very, very important sector in this country because it contributes about 365 billion shillings every year, which translates to about 1 billion shillings every month. That is not a sector that should be underrated. That is a sector that should be promoted so that we can earn more as a country. Because I think any responsible government would want to maximize on its revenue strategies and not undermine the same revenue strategies that is supposed to be promoting. Mr. Speaker, we have seen a lot of challenges with the youth who are in the border sector, who have taken up loans with some of these institutions, lending institutions, and barely a few months after they have taken the loan and repaid some money, these institutions come and take away their motorcycles. And these youth end up losing a lot of money. And I want to thank my colleague from Nandi, who brought a statement to this House on that matter. Companies like Watu, we cannot allow crook companies to continue operating in this country, to continue suffocating our youth who suffer a lot. Some of them have even made savings to pay deposit for their motorcycles, and then just a few months, because of 1 or 2 months default, these companies come for the motorcycle and take it away. We as members of this House, we have on many occasions assisted the youth to recover their motorcycles. But we need a policy on how this will be done. If we have renegotiation, let there be a renegotiation. And that's why, Mr. Speaker, this motion is particularly very, very important and very timely, and I support it, that we need to amend the relevant laws to allow for the renegotiation of the lending terms so that we don't have these many cases of auctioning. If you open a newspaper, Mr. Speaker, you see so many advertisements of people's businesses being auctioned, of people's houses being auctioned. I mean, I think we need to have a model so that Kenyans are given a chance to renegotiate these loans so that they don't end up losing their lifetime investments. Mr. Speaker, even as we say that, and even as I support this motion, we must also look at the real problem. Mr. Speaker, the real problem is the performance of the economy. When you put so many taxes on everything, then you will get here. People will be unable to service their obligations. So I think we need to relook at the taxation policy in this country and ensure that the taxation policy also supports programs like this, where people can borrow and repay the loans comfortably, where banks can lend money and expect their money to be recovered at some point. And I think when we had the coalition government led by former President Mwai Kibaki, we saw something that has never happened in this country, that banks were looking for people in their homes, in their offices to give them money. And they did this without minding that these people will be able to pay this money or not. And people were able to pay. But what has changed? That is the real problem that this House must find out, so that even as we seek for amendments to the laws, we must also understand the causes of this. And the cause, Mr. Speaker, is a punitive taxation policy. If the taxation policy is designed in such a manner that every single penny that a Kenya gets wants to be taxed, then we will have this challenge. We know borders are going through a lot of stress. The cost of fuel has gone up, taxation has gone up, and these young people are all over making rights. But they barely raise enough money to support the repayment of their loan. Some of them are even riding motorcycles that don't belong to them. There are investors who have lent the motorcycle to them. Every day they need to pay back their money to the investor and still remain with something to support their families. So I think even as we talk about supporting our people who are going through this challenge, we must also look at the overall economic picture of this country in terms of taxation, in terms of cost of living, and in terms of even the factors of economic performance like the exchange rate, the issues to do with fuel. All these are issues that will eventually affect our people's livelihood, and they will affect them fundamentally. So I support this motion on the basis that we need to renegotiate the terms and ensure that the relevant laws are amended. But at the same time, looking at the bigger picture of economic performance is very important. Mr. Speaker, yesterday I listened to presentations made by various experts before the bipartisan committee. And the experts were all in agreement, including even government institutions like control of budget, that the taxation policy adopted by the Kenya Kwanza government is going to suffocate our economy. And you know, when we talk about this thing, we don't talk about it because we are in the opposition. We talk about it because we are Kenyans. I think it's important to have a look at the many taxes that are, and the higher taxes that have been introduced by this regime as part of their strategy to revive the economy. You cannot revive the economy by taxing more. So I think it's important for us to relook at the bigger picture so that we can address issues like the ones Honorable Matinga has eloquently explained and put in his motion. So, Mr. Speaker, I support this motion, but I say that the focus should be on relooking at the taxation policy that the Kenya Kwanza government has come up with, relooking at the high cost of essential items in this country, including fuel, then we will be able to address this issue permanently. Mr. Speaker, we were promised by the Kenya Kwanza government that they are going to ensure that Kenya will go into CRB. And they even told us they have managed to remove 7 million Kenyans from CRB. We are not seeing that, Mr. Speaker. We were told that the model of listing in CRB is going to change. We are not seeing that. But we are seeing our young people being put in CRB. They cannot borrow, and they cannot participate in the economy effectively if they are in CRB. What happened to this? I think as we contribute to this, Mr. Speaker, these are very essential questions that we must ask ourselves. That what happened to the promise on CRB? What happened to the promise to the hustlers? And I'm happy this motion has been brought by Kenya Kwanza Senator. The bigger question is, what happened to the promise to help hustlers? Mr. Speaker, I support.
What is your point of order, Gloria?
I've already finished.
Mr. Speaker, we cannot allow this to go on record. I stand on point of order 105 on responsibility of statement of facts. Mr. Speaker, you know Senator Osotsi is by now I can say a ranking member. He was once member. So he understands he cannot mislead the House and the public. The issue of CRB is not as he puts it. And that has been brought on today is specifically on the delivery of the promises that the Kenya Kwanza government gave. Because we are saying, in order to deal with these rogue lenders, we must be able to legislate and present a law. That is why we are looking to amend the Banking Act. That is why we are looking to change those regulations in our financial systems. So by Senator Osotsi trying to mislead people that this government is not, we are overworking. In fact, if you ask me, in terms of these rogue lenders, we want to deal with them squarely, Mr. Speaker. Let Senator Osotsi withdraw that statement and apologize to the hustlers, because that is, we are here for the hustlers.
Senator Gloria, what exactly do you want Senator Osotsi to withdraw or substantiate?
He must substantiate by saying that this government is not dealing with rogue lenders. What does he mean? The motion in itself is dealing with the rogue lenders. By saying that the Kenya Kwanza government is actually not delivering to the promise by not dealing with CRB, yet we are squarely working on that. The Hustler Fund is squarely working on that. And even the issue of CRB, as we speak now, has been changed. So that is misinformation and understanding Order 105 on responsibility for statement of fact. He must substantiate or withdraw.
Senator Gloria, I listened very keenly to Senator Osotsi's contribution. And what he was pointing out was his opinion on the state of the economy and his opinion on the issue of taxation. He mentioned CRB. I think the only thing he has to substantiate is whether or not people have been assisted in being removed on the CRB list or added as he has claimed.
Mr. Speaker, this 105 standing order is continually being misused in this House to curtail debate. You cannot substantiate an opinion. I made an opinion. And Mr. Speaker, just to respond to your directive, I stated in my my presentation that there was a promise that 7 million Kenyans were to be removed from CRB. That is a fact. That is a fact. But my only concern was that, yes, that promise was there. But to what extent has that promise been implemented? Because we are leaders. We meet many youth telling us they are in CRB. That's why they cannot borrow. So I think maybe our colleagues on the other side should tell us more about the status of the promise to remove 7 million youth from CRB. Because we continue meeting youth who say they are in CRB and they cannot borrow.
What is your point of order, Gloria? Senator Gloria.
Mr. Speaker, because Senator Osotsi says we are misusing Standing Order 105, I stand on a point of order for Standing Order 104, declaration of interest. A senator who wishes to speak on any matter in which the senator has a proprietary interest shall first declare that interest. Mr. Speaker, let me say, we promised as the Kenya Kwanza government to remove 7 million Kenyans out of CRB. They were removed. Mr. Speaker, I think Senator Osotsi, because he's listed under CRB.
Senator Gloria, I don't think your point of order is relevant here. Senator Osotsi has nothing to declare interest in his opinion. So I think we will move on. Next speaker is Senator Cherargei.
Mr. Speaker, thank you very much for this opportunity. I want to congratulate Senator Wahome Wamatinga, the Nyeri senator, for always bringing issues on very serious motions. I know on a number of occasions that this is an important motion. So, Speaker, ordinarily, the House should be full because one way or another, you'll always interact with many Kenyans who have had their assets being repossessed but because of non-performing loans. So, Speaker, where the country is now economically is because we are in post-COVID recovery. I know many Kenyans, and even across the world, not only Kenya, during COVID period, many governments across the country, including Kenya, put in cautionary measures to cushion business people, and even they were being paid, Mr. Speaker. Mr. Speaker, therefore, the repossession of movable assets by lending institutions to the non-performing loans, and non-performing loans is where, Mr. Speaker, they are not able to pay. And you know, it's also like international. Kenya now is in the international, both internal and external debt, is standing at more than 10 trillion Kenya shillings, Mr. Speaker, more than. And therefore, this public debt will continue becoming a problem. So imagine if the country was being auctioned because of non-payment of international debt, Mr. Speaker, or public debt. Why don't we use similar strategy? Because if Kenya cannot, for example, pay to the lenders that have lended this country for infrastructural projects, and even, Mr. Speaker, the declining rate of dollar also makes those loans that Kenya is being owed across the country becomes a challenge, Mr. Speaker. So, Mr. Speaker, I think as a country, we use the way we negotiate with IMF, other lending institutions, countries like China, among others, Mr. Speaker. We should also use the same strategy. And I agree with Senator Wahome Wamatinga. As a parliament, we have a unique role to bring in policy and legislative intervention to have renegotiation of non-performing loans, Mr. Speaker. Mr. Speaker, and therefore the non-performing loans in the last year, August 2022, Mr. Speaker, the non-performing loan was at 14%. In August this year, barely 1 year, the non-performing loans across the country has increased to 15%. So, Mr. Speaker, we must amend the Banking Act to give a reprieve to many Kenyans, Mr. Speaker, because many Kenyans borrow to buy motorbikes, to buy small cars like Demio, Aris, and these small ones that they go to app like Bolt, like Uber, like many others, Little Cab Ride and Taxify. And you know, you remember in the last session, we really struggled because companies like Uber, among others, are domiciled in other countries. And you know, Mr. Speaker, I was discussing with some Uber fellows and Taxify, another app of cab across the city, that sometimes they have to switch off the app so that they can use the local rates because the domicile companies like Uber and others were not giving them good rates. So that is why sometimes you even get into an Uber, Taxify, Little Cab, all these small Ubers around in the country. Sometimes they have to switch off so that they can make money because the rates are being given. And that is why government should come in and cushion Because these cars that they are driving, be it Demio and many other cars, Mr. Speaker, and even these small cars that are being used for Uber and others, Mr. Speaker, is cars that they must be given opportunity to pay their loans, Mr. Speaker. So I agree that we must renegotiate, just the way the country negotiates to give reprieve, Mr. Speaker. Mr. Speaker, and therefore the National Treasury should give us strategies to cushion Kenyans, and especially young people, Mr. Speaker. And even we must agree that we must be deliberate through affirmative action to give opportunity. Even we can propose that companies that are owned by young people, they should be given a certain reprieve period because of non-performing loans, Mr. Speaker, and many others. On the issue of motorbikes, border, Mr. Speaker, there is this company called Kenya Women. Mr. Speaker, you know where I come from is a village setup, just like Siaya, just like Vihiga. I know city senators like Senator Amida don't know these things. Our women go to Kenya Women or other lending institutions, Mr. Speaker. They borrow, they bring home. Because of non-entrepreneurship, they make sure that diet changes in that family. So as a husband, you know, you start eating chapatis, you start eating nyama, very nice things, Mr. Speaker, they call chepe, very nice, not knowing that is money from Kenya Women. Mr. Speaker, the husband in Nisone, one morning you wake up, Kenya Women with administration police appear in your place. They take away your TV, you used to watch Cherargay and others, they have taken away, they take away the cupboards, they take away your very good cow, which was giving good liters of milk. They take away almost everything, even sofa sets, even your bed, Mr. Speaker, where you used to make babies. So at the end of the day, Mr. Speaker, it is very, very sad, Mr. Speaker, when it comes to that. And therefore, Mr. Speaker, Professor Kithure Kindiki should not allow administration police to be used for repossession of movable assets. By these sharks, Mr. Speaker, the Shylock sharks, they go and hire administration police and come, take your cow, take your sofa set, take your bed, take your TV sets, even your clothes and everything. So I saw a situation where, Mr. Speaker, the lending institution even went away with the roof, the mabati, Mr. Speaker, the roof. Mr. Speaker, we should not allow our police to be misused by these sharks because simply they have money. They just wake up one day, take your cow, and maybe that cow, Mr. Speaker, like Kenya Women, among others, they are busy repossessing, they are destroying marriages. Because by the time a wife goes and borrows a loan without the knowledge of the husband in our villages, it kills that family. Because after they have repossessed, there is no option but the wife to run away because now the mzee or the husband is mad, Mr. Speaker. So we must call out. We must renegotiate. Non-performing loans is not only unique to hustlers or to ordinary Kenyans. It's also among Kenya as a government because it has international obligations to pay. So, Speaker, on the issue of motorbikes, I saw the other day, there was what we call mogo credit. The police tried to possess the motorbike in this city, I think it was last year or early this year, and the border guys dealt with the mogo credit and the police. That's why I'm saying the police should not be used. Under the Police Act, there is nowhere Senator Otsotsi or Mr. Speaker, sir, that says police officers, be it administration police or National Police Service or GSU, are supposed to be used to repossess any movable assets. We must start from there, Mr. Speaker, because it's non-performing. And I want to say, people like what to credit. I brought a statement in this house, Mr. Speaker. What to credit, when they realize you have almost paid up to 80%, they take away your motorbike. And some of these motorbikes, Mr. Speaker, are not even owned by the border riders, Mr. Speaker. Mr. Speaker, as my brothers have said, motorbike is what has, and border sector has stabilized the economy of many young people. It has created opportunities for many young people, Mr. Speaker. Although there are many challenges where we are blaming borders, maybe because people sometimes say because of them is insecurity, but it is the most reliable form of transport. So, Speaker, if you were to come and preside over the session in the afternoon, maybe 2:30, and you are just flying in at JKI and there is heavy traffic, the only option is to hop into a border and you will be within 10-15 minutes, you are within the presence of us. We have been using border, Mr. Speaker. Even in the villages, it's deficient. Our roads are pathetic. You had me complaining over the weekend in Nandi. We have so many stalled road projects in Nandi. You heard me speaking on Friday, Mr. Speaker, to be precise. The only place can be accessed in Nandi is through motorbikes because the roads are very pathetic, Mr. Speaker. And in some of these is the borders assist us in movement of economy, growth of economy, Mr. Speaker. Even, Mr. Speaker, where roads are not passable, borders are being used to transport even the sick people to rush them to hospital. And it has saved many lives, Mr. Speaker. There have even situations there that their roads are not passable, Mr. Speaker, where they have even been used to carry coffins of the dead because the roads are not passable, Mr. Speaker. So people like what to credit, I think the government must crack down, Mr. Speaker, because these people time. Imagine, what reason do you have if out of 12 months, you only miss 1 month? And you go, and I've been discussing with these borders, they go and see this what to credit or platinum credit, and tell them, Mr. Speaker, this month I was sick. I was not able to go to work. These are treatment cheats. I went to the doctor. For this 1 month I was sick. And you know, border people are exposed to cold. They get pneumonia. They become sick, Mr. Speaker. They go to this what to credit, another platinum credit, another lending consult like Mago credit, and tell them, Mr. Speaker, I was sick in this month. Therefore, I cannot honor my loan. What is so hard for those people to understand? Does it mean they must be ruthless or heartless so that they make an devilish or an holistic profits by all extents, Mr. Speaker? So this what to credit, the platinum credit, the Mogo credit, Kenya women, among other these microfinance, Mr. Speaker, must be called out. And the only way to fix them, a silver bullet fixing them, Senator Oburu Odinga, is to bring an amendment to renegotiate non-performing loans, Mr. Speaker. Among the young people, Mr. Speaker, and I am happy Senator Oburu Odinga is here. I don't know whether he was in the King's State banquet. I didn't see him. But, Mr. Speaker, because the king is in around, and I know Senator Oburu must be friends with the king. Okay, maybe I will ensure next time you are invited, Mr. Speaker, so that you can. I'm told Senator Oburu might be knowing each other with King Charles III and Queen Camilla. Mr. Speaker, that is why I know even in Siaya, even in Vihiga, even in Nyeri, most young people, they have motorbikes are being repossessed. Mr. Speaker, it pains me to explain this, and Senator Utsosi has put it very well. These people time when you have 1 to 2 months before you clear. And by the way, Mr. Speaker, ordinarily, a new motorbike should not go beyond 80,000. Can you believe through what to credit, platinum credit and other credit societies, you end up paying almost 300,000 for a motorbike that you can buy in cash at 80,000 shillings, Mr. Speaker. So, Mr. Speaker, this is a pure rip-off. How can you take and pay more than 200%? A new motorbike, cash 80,000 plus. You end up paying what to credit or these other credits like Platinum, Mwago, and others, you end up paying over 300,000. What explanation? Which economy are we doing in this country? What are we supposed to be doing, Mr. Speaker? And these borders depend on that 50 shillings, 100 shillings, 200 shillings, Mr. Speaker. I am telling you, these credits, microfinance credit like Kenya women, like what to credit, like Platinum, like another credits, it is a criminal, well-organized criminal enterprise. I don't fear to say this. Where they work in cahoots with some broke police officers, with some OCSs and OCPD, and the National Police Service Commissioner, Mr. Speaker, and it is good you sit in National Security Committee. You must assist us in follow-up. There are certain OCSs and OCPD, and National Police Service Commission must be aware of this. They work in cahoots with these microfinance when they are going to repossess motorbikes and resell. In fact, when they repossess, they don't even tell you, come and pay. They repossess and go and dismantle into spare parts and sell it, Mr. Speaker. And the young man, the young woman has paid. Out of 10 months, he has paid 9 months. Mr. Speaker, we must protect Kenyans from this ruthlessness that we see. Mr. Speaker, in conclusion, because I didn't want to speak a lot so that my colleagues can get a chance, I want to inform the House. There is what we call Hustler Fund. Let me put two things in straight because I've had my colleagues misleading the House. When the president campaigned, he said, he did not say, and I want to put it correct because some of us were part of the drafting of the manifesto and the plan. I know the manifesto like the back of my hand. He said he will remove Kenyans who are CRB then.
so that they can start afresh. He did not say he is banning Kenyans from being taken to CRB. So let us get our facts right, and that is what we said, and it was done. Number two, we said to cushion Kenyans from these harsh economic times is to start what we call Hustler Fund, where young men and women and business people and cooperative society, women groups could go and borrow and start their businesses. And the Ministry of Cooperatives is doing very well. You saw even the indications, the indicators, Mr. And I want to correct this notion. The IMF, I have realized our brother senator from Vihiga is a good reader of the information, but he ensures that the information he gives is skewed. Kenya was ranked among the best countries by IMF. International monitoring coming strongly economically in the nation, Mr. Speaker. So the issue of Hustler Fund, and I want to encourage the young people from Vihiga County, women from Vihiga County, and even from Siaya, to borrow the Hustler Fund. It is your money. Go and start businesses so that we can even from Nyeri, from Nandi, to borrow and start your business through the cooperative societies. Mr. Speaker, the Hustler Fund is the only fund that you don't need to know anybody. It is you and your phone. You don't need to have a godfather. You don't need to have a girlfriend. You don't need to have a husband or a wife, Mr. Speaker. You don't need to have to know anybody. You don't need to say, I know so and so that you can borrow from the Hustler Fund, Mr. Speaker. So I want to correct the misnomer that was being put in the House, Mr. Speaker. We must agree as a House that, Mr. Speaker, the Hustler Fund is going to be revolutionary. All Kenyans, all young people who are watching me, borrow from the Hustler Fund and your lives will be changed. In conclusion, Mr. Speaker, I agree with the prayers that we have set to review the Banking Act, to renegotiate non-performing loans, and provide cushions with Kenyans and prevent the loss of their movable assets. These assets that they have, let them protect. Mr. Speaker, I want to assure the taxi drivers of Uber, Taxify, Bolt, the border sector, that Senate will stand with you to protect you from the sharks, from the Shylock, and other unholy microfinance institutions in this country, like Watu Credit, like Platinum Credit, like Kenya Women, among other lending institutions that continue to crash, Mr. Speaker. And I wish, in conclusion, with a lot of due respect, that we would have used the model way of the Islamic laws of banking. We would not be where we are. If we had proposed to use Islamic bank where there is zero interest rate, Mr. Speaker, then this country would not be where. I hope when we renegotiate, we must look at to borrow some from Islamic banking laws on how we can improve. Mr. Speaker, with so many remarks, congratulate Senator Waume Wamatinga. Wish him well. I want to see the legislative intervention when it comes to fruition. And I invite Senator Utsosi for lunch so that he can see and I can share with him how the economy is doing with the experts, so that when he appears before the floor of the House, he can be able to have a very interesting...
What is your point of order?
I finish, and I support. I finish.
What's your point of order, Senator Osotsi?
Mr. Speaker, you know I don't need any lectures from Senator Cheregei on the economy. We are feeling it. The economy is not working, and Kenyans are feeling it. So you don't need any lectures to know that the economy is not doing well.
I thought you had finished your, your remarks. It's not a point of order even. Senator Oburu Oginga.
Yeah, thank you, Mr. Speaker, sir, for the opportunity. Mr. Speaker, I want to thank my chairman of Energy Committee, Senator Wamatinga, for bringing this very, very important motion. Mr. Speaker, this motion is important because it affects our youth. The youth are the future of this country. Therefore, Mr. Speaker, when you have issues which are actually making the youth go into the abyss, you make the youth almost go bankrupt. Mr. Speaker, you are ruining the future of our country, not only of the youth. Mr. Speaker, I know that interest rates in this country are very high. And the reason why interest rates are high is because the government is also borrowing from the market. The government is borrowing at very high interest rates. The CBR rates now, which the government uses to borrow money from the money market, from the local market here, is 14–15%. Mr. Speaker, it is more attractive for the banks, the microfinance institutions, to buy those treasury bonds and treasury bills comfortably because it is more secure than lending money to borders and lending money to ordinary business people. That is why there is scarcity of money to lend. Now, when there is scarcity of money to lend, the banks and microfinance institutions lend it at very high interest rates. They put very high interest rates because they don't care. They know that they still make their money, whether they lend out the monies or not, because they are very comfortable in the treasury bill rates, which they are paid comfortably because it is more than guaranteed, because it is government bonds. Mr. Speaker, this ruins our youth. If you look at the newspapers, Mr. Speaker, you will see, if you take The Nation, you take The Standard, you will see the advertisement. These people called auctioneers are in a field day. Mr. Speaker, these people are in a field day. I think that business called auctioning has become so lucrative that, Mr. Speaker, I think I would earn more money there than being a senator. Mr. Speaker, yeah, because otherwise, why are there so many auctioneers? The newspapers are full of those adverts, Mr. Speaker, on a daily basis. Mr. Speaker, these are Kenyans who are being auctioned. And I can tell you, Mr. Speaker, there are people here who are very comfortable. They talk politics. They talk about auctioning because it is politics. But, Mr. Speaker, I can tell you that personally, I have an experience of being auctioned. Mr. Speaker, it is a very, very thrilling. It is a very, very bad experience. Because you have a dream. When you are buying a motorbike, you have a dream that you want to buy one, then you want to multiply it. You want to be, everybody wants to have something. You want to be comfortable. You want to be able to educate your children comfortably. You want to be able to take 3 square meals a day. You want to, but Mr. Speaker, when you see that investment of yours going sometimes into the air, into the thin, disappearing. Mr. Speaker.
Senator Oburu, I will interrupt you because it's already 1 o'clock. When we resume this debate, you will have a balance of
municipality. Where is Makiri? Makiri is in Maua, just adjacent to the deputy governor's home. So this rally was held adjacent to the deputy governor's home? Yes. Do you believe it was a genuine charity that was being held at the adjacent to the deputy governor's home? I don't believe so, because I watched the proceedings and I also saw the governor castigating the deputy governor, in fact praying that Arad can visit his family. Saying what again? During the rally, I watched the proceedings. Yes. And it was a rally convened to disparage the deputy governor, because I saw the governor praying, kneeling down and asking the congregants in the rally to pray so that Arad can visit the deputy governor's family. Okay. Let's go to paragraph 8. Mr. Speaker will later show you why it was important to provide that context. But let's go to paragraph 8. What does paragraph 8 there say? It states, paragraph 8, that
The respondents and their group damaged several motor vehicles belonging to the county government of Meru, and for some individuals, that is registration number KEX 574V and KCB 845F, using stones and other crude weapons, and an act which culminated in a cow belonging to the governor being stolen and killed, which is prejudicial to public order and the security of the county.
We were told in the opening statement that we are misrepresenting the ownership of the motor vehicles. Is that paragraph clear that the specific motor vehicles named are private?
It is clear because it earns and for some individuals.
It earns for some individuals, and it indicates the registration plates given are for the individual vehicles, isn't it?
Yes.
Does it also indicate that several motor vehicles belonging to the county government were damaged?
Yes, it does.
Should motor vehicles belonging to the county government be present in an Okolea function, which the Senate was previously told is a private function, charity?
They shouldn't, because we have been told previously it is a private charity.
But who is the maker of this application you have produced at page 42? Who is the applicant?
The applicant is the Republic through DCI Igembe South.
It is the Republic of Kenya through the DCI.
And the name of the DCI is Kelvin Wafula, PC Kelvin Wafula, number 11.748.
Police Constable Wafula, isn't it?
Yes.
Would you, in the ordinary course of events, expect a police officer to make such allegations frivolously?
No, since they were also made in front of a competent court of law.
As a matter of fact, has that police officer sworn an affidavit in support of this allegation?
Yes, he has sworn an affidavit.
Where is that affidavit, sir?
Affidavit is on page 45, 45, 46, and 47 of volume 2.
Again, you confirm the affidavit mentions, I believe at page 43, paragraphs 3 and 8, again, the same motor vehicles and the same allegations we read, isn't it?
Sorry?
Can you confirm that paragraphs 3 and 8 of that affidavit again mention Governor Kawira Mwangaza, and they mention them that county motor vehicles were damaged?
Yes, it does.
What evidence have you placed before the Senate to show that county officials were involved in this Okolea rally and in the mayhem that ensued?
I have placed before the Senate a charge sheet, 2 charge sheets, and also the pay slips for the persons who are charged to ensure that they are county employees.
So where are those documents to be found?
Page 48, 49, 50, and 51 of volume 2.
Let's confirm just 2. Who is the county official charged by the DPP at page 48?
He is called Salesio Munene Kanga Alaya Samaritan.
Have you placed the payslip to show this particular gentleman is an official of the county?
Yes, on page 50.
At page 50?
Yes.
Mr. Speaker, I now request that we play videos in support of count 2. They are brief videos, we can have them played. No, in support of count 1, sorry, Mr. Speaker. Video in support of count 1. I don't know whether we're having technical challenges. They should be having sound, Mr. Speaker.
Can the person playing the video restart and put it at maximum?
Bwana asifiwe. Kama kwa ndoto bwana. Bwana asifiwe. Na tueleze. Tutaonelea nikiwa na tunaijua. Hiyo watasahau. Wapi wakina mama wazee? Bado tuongezewe. Pastors wakuje hapa kwanza tuombe. Nitoe kama na ng'ombe ngine kwa eteka ajili ya kiapo mwako watu kwa watetea. Unaona angalia mwako wako watetea. Tunaenda toki nyanja. Tuingie kwenye neema itamwanda wakia. Inua mkono juu. Back to the center. Ndawa back to the center kwa back to the center. Unaona ukomeni. Na ukomeni. Eno analeta na mbele. Aleta na ngare. Eno ni borisi. Aleta ni basa borona. Ndawa back to the center kwa back to the center. Angabakia. Bwana asifiwe. Totea na hura. Katiba ya Kenya leta kija muntu kwenda onde ala kwenda. Oni ndenga bana nteri nyaka ana kumukuma compound ile toka natia mochili wako nyungwa. Joto mochili wa muntu. Kwa hivyo kama umepangwa kukuja hapa, tuko hapa tayari, tutapambana kiroho, tutapambana kisheria na hakuna uoga. Bwana asifiwe. Na ingo chokelea ya ile okay ya kuwa no koromo ikawera ari governor 2077 yete kuraya. Ruama na maoro yako ya ile. Tukutambue. Tukiomba kutambua no tuko tumira ana beto kwa maia. Hiyo ni ujinga na ni ukumbavu. No ndoto kwa ya wangu ni maia. No ndoto maana ba kwa maia. Ya wangu ana moko kwa maia. Kana wewe ya wangu ya maia. Tukuone kiani neke. Ile tu akutambua. Lakini hii chimeta nyamba. Utumira tu ana to hizo rozeri.
In the interest of time, past Mr. Speaker, we could move to the next video if he hasn't moved.
Maybe to add, cancel the transcript of what is happening in the video is on pages 52 and 53 of volume 2.
In that video, have we seen the governor addressing the crowd there?
Yes, I've seen her.
Was the crowd initially peaceful as the governor addressed it?
Yes, it was.
Did the crowd at some point turn violent?
Yes, they turned violent.
Would you attribute the violence we have seen with the utterances that the governor made?
It can be attributed to the utterances of the governor.
Why?
Because she castigated the deputy governor and the people there. It's around the deputy governor's home, therefore the crowd turned violent after the deputy governor was attacked by the governor.
Mr. Mawira, politicians attack each other all the time. Perhaps we can't read much into that. But do you consider it normal, even within the rules of politics, for a governor to take a vilification rally right to the home adjacent to the home of our deputy?
It's not normal, and to hand, this was after the deputy governor and come out and saying that he was mistreated, and therefore the governor had taken the rally near his home so that he can castigate him more. Therefore the crowd, that's why they turned violent and protested against the mistreatment of the deputy governor because it was the last stroke that broke the camel's neck, if I can say.
Is the violence we have seen in that video consistent with your charge that county motor vehicles were damaged, as we have seen from the police officer?
Yes, but because we can see vehicles being stoned, and the police officer saw an affidavit that county government vehicles were destroyed during that rally, meaning they were present in the rally.
Let's go to count 2 of your impeachment motion, specifically paragraph 12A, where you accuse the governor of misrepresenting as relatives as a technical team for purposes of benchmarking cancer treatment equipment. Have you provided any evidence, sir, to show that the governor misrepresented our relatives as technical people for purposes of cancer management?
Yes, I presented the evidence in volume 2, pages 58, page 60, page 68, 76, 77, and 86. And also there are 2 videos to support the allegation.
To the best of your knowledge, sir, is there a county in the Republic of Kenya with an incidence of cancer comparable to Meru?
None, because even studies have shown that Meru has the highest incidences of cancer in the Republic of Kenya.
To the best of your knowledge, sir, is there any other place in the world with the higher incidence of cancer per square kilometer than Meru County?
From studies also, Meru has been stated to have the highest incidences of Kenya per square kilometer in the world.
So I would not be wrong to say Meru is sort of like the world headquarters, for lack of better language, when it comes to this very debilitating disease.
That is true how you have described it.
Would one expect a governor given the opportunity to deal with the disease affecting our county more than any other place in the world to send the qualified people for purposes of that cancer management equipment and setting up the cancer treatment center?
It will be unexpected.
Would you expect a governor to see this invitation to China in a county that has the leading incidence per square kilometer in the world on cancer, to see it as an opportunity for our relatives to go on safari?
It will be unexpected.
Would that be a governor who behaved like that? Would they be in gross violation of the Constitution?
Definitely, he or she will be in gross violation of the Constitution.
Would they be in breach of their oath of office?
Of course, yes.
Let's go to that page 58 that you mentioned. At paragraph 4, does the governor admit that these people we are talking about are our relatives, at least 2 of them?
Yes, she has admitted by indicating that one is a security personnel and the other one, the sister, is a personal assistant.
That letter, sorry, Madam Speaker, I've lost track. I'm a short-sighted man, that's why I was requesting for. That document you just read begins at page 57, right?
Yes, it starts at page 57.
At the top, it says it's coming from what office?
County Government of Meru, Office of the Governor.
This is a letter from the Office of the Governor.
Yes.
To whom is it addressed?
The Chief Executive Officer, Ethics and Anti-Corruption Commission, Integrity Center.
And what is the date of this letter?
26th October 2022.
So you confirm as of 26th October 2022, there were already issues about the governor's relatives and nepotism and involvement in the county.
I confirm.
Let's go to page 60. What is that document there, sir?
It's a letter addressed to the Governor of Meru, Her Excellency Kawira Mwangaza from the Beijing League Tech Company Limited.
Who is Beijing League Tech Company Limited?
From the letter, it's a company in China that specializes in linear accelerator machines designed to treat cancer.
What does paragraph 1 of that letter say?
It says, we are delighted to invite you and your distinguished members to visit us in China for you to witness and benchmark our state-of-art linear accelerator machines designed and manufactured in China in reference to our planned cancer treatment center in Meru, Kenya.
So this company planned to set up a cancer treatment center in Meru?
Yes.
And in paragraph 2, what type of equipment do they say the governor and our distinguished team should go and benchmark?
Indicate that they will also have an opportunity to visit other medical equipment manufacturer that produces digital radiography, X-ray equipment, and mobile C-arm that they plan to manufacture and assemble in Kenya, preferably in a designated special economic zone.
Let's go to page, I believe, 76. What is that document, sir?
It's a letter from Office of the Deputy President, State Department for Devolution, addressed to the Principal Secretary from the HRM and DO1.
What is this letter requesting? What is it about?
It's about travel clearance to China.
And what does it say?
The county government of Meru has requested for clearance from its county officials to travel to China for a study tour. Beijing League Tech Company will meet all the expenses pertaining this trip. Then it indicates recommended for travel and also forwarded herewith please find letters on the above subject for your consideration and signature.
The letter at page 77, what is it? Where does it emanate from?
It's a letter from the Office of the County Secretary and Head of Public Service.
Addressed to who?
To the Principal Secretary, State Department of Devolution.
And who are the persons indicated as the ones to make this travel to benchmark the cancer equipment?
They are indicated as Dr. George Mungania, who is the CCM Health, Ms. Miriam K. Guantai, who is the PA to the Governor, Mr. Nefat Kenya Meme, who is the Director External Leakages, and Mr. Murangiri Kenneth, indicated as works under the Department Administration.
To the best of your knowledge, is Dr. George Mungani an oncologist?
No, he is a pharmacist.
To the best of your knowledge, were there people in the county better qualified than this person to go on this trip dealing with the problem threatening the existence of Meru County?
Yes, because the county government of Meru has employed oncologists and also
His qualifications?
When he was employed as a pharmaceutical technologist.
To the best of your knowledge, is this a person who would have any knowledge relevant to management of cancer?
None.
This is the same gentleman we saw receiving